Hello, good morning.
Music. 보세요. 상관없나?
Good morning, Excellencies, ladies and gentlemen. It is with great pleasure that I welcome you to the live forum for candidates for the election of the next WHO Regional Director for the Western Pacific. As you know, the Life Forum for candidates complements another feature of the election process. That is the password protected web forum only accessible to member states for question and answer with candidates then the Secretariat opened on 4 September 2023. The live forum for candidates has been convened at my request and on behalf of some WHO Executive Board members from the region. In the absence of any objection to the proposal to hold a live forum, as circulated through the communication of the Acting Regional Director of 22 August, it was considered as agreed upon and the regional office proceeded with the practical arrangement of the live forum. Let me thank you all for the support given to this initiative and to the Secretariat for its readiness in organizing it. As you know, this is a non-decision-making platform intended to provide an opportunity for candidates to present their experience, expertise, and vision to enable member states to acquaint themselves with the candidates. Participation in the forum for candidates is limited to regional committee members of the Western Pacific and a limited number of secretariat staff. Webcasting, please note that this forum for candidates has interpretation in Chinese, English, and French, and it is being webcast for public viewing on the regional office website. We kindly ask all those in the room to have their phone off in order not to disturb the conduct of the live forum. Arrangement for the interview. Let us turn to the arrangement for the interview. With the communication of the Acting Regional Director on 22 August, the Secretariat circulated my proposal in advance to this meeting for each candidate to make a presentation of up to 20 minutes, which will be followed by a question and answer session so that the overall duration of each interview will be up to 60 minutes. May I recall that the detailed proposed arrangement for interview are as follows. Presentation of candidates, turning first to the initial oral presentation. The oral presentation by each candidate is not exceed 20 minutes. While 20 minutes is allotted for the presentation, candidates may wish to make a presentation of less than 20 minutes in order to leave more time for question and answer. Selection of question. As far as the process for selecting question is concerned, each regional committee member joining the forum may ask question. If it so wish, regional committee members were invited to indicate the candidates they wish to ask a question by writing to the regional office not later than 13 September at 17 p.m. Philippine time. The Secretariat kindly extended the deadline until 7 a.m. today. Tokens bearing the name of all the regional committee members who notify the Secretariat that they wish to ask questions were put into the relevant receptacle, one for each candidate. The Secretariat has received questions from a regional committee member after the extended deadline, but before the opening of the forum, I would like to propose that we include the tokens bearing the name of this regional committee member in the relevant receptacles. Is there any comment on this proposal? I see none. And I would therefore ask the Secretariat to add the token to the relevant receptacle. Let me remind you that member states that nominated the candidate are expected not to ask a question to the candidate they nominated. After each candidate has made their oral presentation, I will pull the tokens one by one on a random basis until the time available is exhausted. After each token is drawn, the corresponding regional committee member will be invited to ask their question and the candidate invited to provide an answer. Question and answer. As a concern the procedure for the question and answer session, regional committee member we have up to 1 minute to ask one question only. Please do not divide question into different parts so that there is in fact more than one question. I would ask that members who lost have been drawn and are therefore provided the opportunity to ask a question kindly refrain from posing a question to a candidate which seem identical or substantially similar to one already addressed to that candidate. I would also ask the members of the regional committee to please have their camera on and to unmute when given the floor. Candidates will have up to 3 minutes to respond to each question. Each interview will conclude when 60 minutes have elapsed. Even if there are still questions pending, however, a candidate will be permitted to complete their answer to the question being addressed when 60 minutes have elapsed. Should there still be time available after all the tokens have been drawn, I will open the floor to the regional committee members which have not yet asked a question to see whether they wish to do so. I will give the floor to member in the order in which they raise their hand in Zoom. If following this there is still time available, the candidate may, if he or she wish, make additional remarks within the remaining time. Regional committee members connected online and those of us in the room will see a clock on the screen indicating how much of the 60 minutes allotted per interview remains. There will also be a clock indicating how much of the 3 minutes time limit for responding for each question remains. This will be used to help participants keep within the time limits. Because of these strict time limits, I ask all regional committee members not to interrupt the interview process by taking the floor unless this is on a matter dealing with the conduct of the interview. Are there any questions? I see none. I therefore take it that there is an agreement to follow the proposed modalities. Timetables. In line with other WHO meetings of this nature, I propose that the working hours are from 9 a.m. to 15:30 Philippine time, with a short break in the morning between the first and second interviews, and a short lunch break between the third and fourth interviews. Is there agreement to proceed in this way? I see no objection. 3 order of interviews. The order of the candidates' interview was drawn on 14 September in the virtual presence of regional committee members and a limited number of secretariat staff who attended the briefing on the code of conduct and the rules of procedure related to the nomination process. It was communicated to regional committee members and candidates immediately afterwards. Accordingly, the program of today's forum is as follows. During this morning session, the first interview will be Dr. Song Lee, followed by the interview of Dr. Jimmy Rocher, and by the interview of Dr. Saya Maupiokala. The forum for candidates will continue this afternoon with the interview of Dr. Susan Mercado, followed by the interview of Dr. Chanti Chiang Huang. The order of the interviews is listed in the program for the live forum for candidates, which was sent to members of the regional committee. I now kindly ask Dr. Song Lee to remain in the room while other candidates are invited to leave the room until it is time for their interview.
There's no Chinese channel. Yeah.
We just wait for the technical to set up the interpretation in Chinese, and then we will start the first candidate in a few minutes. We just testing the interpretation in 1 minute, so just wait.
Testing, testing. This is interpreter speaking.
Chinese
Interpreter.
It's okay now. So we're still waiting for this.
Testing, testing. Testing, testing. Can you hear me?
It's okay now. The interpretation in Chinese are not yet fixed, so we still have to wait.
Testing, testing. This is the Chinese booth speaking. Can you hear me?
Okay. So how is the interpretation setting?
Testing, testing. This is interpreter speaking. Can you hear me? This is the Chinese booth speaking.
English channel from the Chinese booth. Chinese booth speaking in the English channel. Can you hear me? Now switching to the Chinese channel.
Okay, okay. Thank you very much.
北京可以听到，不是还静音啊？北京可以听到，谢谢啊。
How
Yes.
is
Yes, we can hear you from Beijing. We can hear you from Beijing.
try it? So could you interpret what I said? Is it okay?
Can we ask the Chinese interpreter to speak, please?
Yes, I can speak English, but I couldn't hear the channel 3. There is no Chinese because when I speak Chinese, English, I want to confirm if they can translate into Chinese correctly. But from the channel 3, there is only English. The channel 2 is French. The channel 1 is English. No any Chinese translation.
Chinese interpreter, can you speak into the Chinese channel, please? Chinese interpreter, please speak into the Chinese channel, please. Is he speaking? 1 second.
Okay. Interpreter, can you speak Chinese?
It's okay now.
It's okay? Okay. Can you hear Dr. Song Li?
Speak loudly, okay. Yes, yes, 大点声音，再大一点声音。哎。Yes, I can hear it. Yes.
Okay.
Yes.
So I am sorry that for technical issue. So we will now start with Dr. Song Li. Thank you for Dr. Song Li, Dr. Song, for joining this interview today. Please proceed with your oral presentation of up to 20 minutes. You may do this standing at the podium or seated at the table. You have the floor.
Thank you, Mr. Chair. Your Excellencies, distinguished delegates, colleagues, ladies and gentlemen, good morning. It's an honor and a privilege for me to make the presentation today. I almost lost the opportunity. I mean it. In 1977, when I was 3, living in a very poor village with my grandma, due to the lack of vaccination in the village, I got measles. After 5-day high fever and pain, I narrowly survived. The pain has stayed in my memory forever. So I can feel the pain people suffer from their diseases. It had lightened up my dream to be a health practitioner. When I became an obstetrician and gynecologist, I can feel the pain of my patients with cervical cancer and the sorrows from their children and family. The pain reminded me of my responsibility to provide my patients with the best possible care. Later, I became a public health official, and I have devoted myself to dealing with the pains of the population to ensure health and well-being of the 1 billion women, children, and adolescents in China. I led the team for the formulation and implementation of national laws, policies, strategies, and programs in this field. I'm proud of my contribution to the achievements. The maternal mortality rate has been significantly reduced to 15.7 per 100,000, and the infant mortality rate to 6.8 per 1,000. This enabled China to reach the targets of SDGs 3.1 and 3.2 ahead of 2030. Over the last 2 decades, since I joined Ministry of Health, now National Health Commission of China, I have led the design and implementation of a lot of projects with WHO, UNICEF, UNFPA, World Bank, Gates Foundation, and other international partners. I actively participated in WHO's Strategic and Technical Advisory Group, UN Every Woman, Every Child Global Partnership, as well as China-Africa Health Collaboration and South-South Collaboration. In my journey of healthcare, public health, and global health, what has motivated me to go on is the unconditional love and hope for life and well-being for everyone. Now, I am keen to work closely with you to promote health in the Western Pacific region. Ladies and gentlemen, we are from 37 countries and areas of different cultures and development status, but we are sisters and brothers, sharing the same emotions and feelings with a shared future. Just as an island country saying goes, the ocean connects us all. I understand the diverse and emerging health challenges in our region. I am aware of the urgent need to build a robust and sound health system to meet the emerging health challenges in our region. I firmly believe the importance of keeping people safe, respected, empowered, fairly treated, and duly recognized. Most importantly, what remain the aspiration of our region in the future health are equity, safety, innovation, and collaboration. I believe health must be equitable, as stressed by the WHO Constitution. The enjoyment of the highest attainment standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic or social conditions. The situations facing women, children, the poor, the elderly, the disabled, and other vulnerable groups make it clear that equitable health care is the only viable solution. Over the past decades, much progress has been made in the economy and society in the Western Pacific region. However, inequity in health and well-being still persists among our visiting countries and areas. In our region, NCDs were the primary cause of deaths for 12 million people, accounting for 87% of our deaths in 2019. Rising risk factors and changing environments have reversed progress in some countries. In addition to NCDs, the region's health status and challenges are diverse. Life first. To achieve health equity, is to ensure everyone in the region has a fair opportunity to live a healthy life. And it is the WHO mission to support each member state to achieve availability, accessibility, and affordability in healthcare and leave no one behind. Let's work together for an equitable future. And how? If elected, one of my priorities is to recommit to the well-being of the vulnerable groups, including people with psychological challenges. As WHO reaffirmed, health is a state of complete physical, mental, and social well-being, and not merely the absence of diseases or infirmity. So we need to further enhance community-based healthcare practices and accelerate the implementation of the Regional Action Framework for non-communicable diseases. Another priority is to focus on the health status of the island countries and areas. We need to mobilize more resources to strengthen the capacity building of health systems to narrow regional net gaps. It's also important to improve primary health care so as to realize universal health coverage. We must work hard to ensure equal access to diagnostic tools, medicines, vaccines, medical devices, health workforce, and health services. In addition, I will advocate health for all and all for health policy to address issues related to social determinants of health by strengthening strategic dialogues with the heads of states and governments and ministers of finance, agriculture, environmental protection, and other relevant stakeholders. Ladies and gentlemen, in 2003, when I was assigned to work at the SARS response headquarters in Beijing, it was a transformative experience for me because I witnessed the power of early disease detection, diagnosis, and early intervention in formulating health policies. In 2008, after a severe earthquake struck Sichuan province in southwestern China, I led an on-site medical emergency team. Day and night, rescuing the injured provoked me to think about the significance of building resilient health systems against natural disasters and disease outbreaks. The COVID-19 pandemic again alarms the urgency of prevention, preparedness, and response for health emergencies. Our region is frequently attacked by the emergence and re-emergence of epidemic-prone diseases, climate change, and various natural disasters. The cost is huge. It is estimated by the WHO that in Western Pacific region, ambient air pollution alone causes more than 1 million deaths in the region every year. Safety, like air and sunshine, is hardly noticed when we are benefiting from it, but none of us can live without it. Prevention is better than cure. We must work together for a safe future. What steps can we take? We must draw harsh lessons learned from the responses to COVID-19 pandemic, avian flu, dengue, malaria, and other public health crises. The adoption of One Health approach in responding to global health threats is essential in this regard. We must accelerate members' capacity building in response to public health emergencies, including tsunami and earthquakes, by strengthening health emergency prevention, preparedness, response, and resilience. I hope VIPRO could provide further technical assistance to members in establishing climate-resilient health systems and galvanize commitments to antimicrobial resistance surveillance, research, and management, and strengthen the AMR quadripartite and multi-sectoral engagement. We must seize the opportunity of the ongoing intergovernmental negotiating body of the Pandemic Accord and the revision of international health regulations to strengthen global health security governance. It's important for the VIPRO to support members in actively participating in the process. Ladies and gentlemen, the Western Pacific region is rapidly changing economically, socially, and environmentally. New solutions are urgently needed to address the rising health challenges in the region. Innovation is not only about technology, but also about health service delivery models, management systems, and more beyond. I deem it important to build innovative health. In my experience, e-health in diagnosis and consultations enable the precious medical resources to be more equally distributed, even in the far-reaching areas. I was so excited several years ago when I knew the new technology had shortened the waiting time for HIV testing from 14 days to 30 minutes. Digital technologies were harnessed to support the public health response to COVID-19 worldwide. Artificial intelligence has been applied increasingly in the areas of healthcare administration, public health, medical research, training, diagnosis, surgery, and hospital care. We must promote healthcare system transformation, focusing on availability, accessibility, and affordability of medicines, vaccines, and medical services, as well as uplifting the capacity and morale of medical personnel. To that end, the regional office can expand its support on cross-country and region cooperation and collaboration in new and appropriate application of health technologies, implementation of WHO global strategy on digital health can provide an opportunity for the countries to scale up digital health with a view to improve the quality and coverage of health services and promote innovation in primary health care. More importantly, we need to foster a culture of innovation. The VIPRO can further promote regional mechanisms on innovations to share best practices, knowledge, and technology, and assist members in building innovation-driven health systems. Ladies and gentlemen, as we are aware, public health challenges in our region are complex and diverse. Solutions for the emerging and re-emerging health challenges tend to be time and resource consuming. It's beyond one single country's capacity to address such challenges. Therefore, solidarity is essential to address the rising problems of health system and other social determinants. It's imperative for us to deepen interregional and international collaboration. It's imperative for us to work in close collaboration with members, WHO headquarters, regional and country offices, and other partners such as civil societies, international finance institutions, multilateral development banks, and UN agencies. Collaboration, among other important things, is ingrained in the DNA of WHO. Let's work together for a collaborative future. In my view, we must communicate effectively with the WHO headquarters, regional and country offices in the implementation of our mandate with a focus on strengthening the capacity of country offices. We need to create synergies within and beyond health departments among various stakeholders. At the same time, I hope to strengthen the engagement with civil society, academics, and other non-state actors in jointly addressing regional health challenges in line with WHO framework of engagement with non-state actors. I will strive hard to improve efficiency, transparency, and inclusiveness in decision-making. I will ensure the empowerment of each and every staff by cultivating an inclusive, diverse, respectful, and enabling working environment within the regional office. Ladies and gentlemen, as a saying goes, one who has health has hope, and one who has hope has everything. My career and experiences have filled my heart with love and hope to safeguard everyone's life and health. 10 years ago, I met a pregnant woman in a border village, the high prevalence of HIV. She was very sad, but knowing she had AIDS, I gave her a warm hug and calmed her. Don't lose hope. You will have a healthy baby because we have medical service and new technologies and medicines. At that moment, her eyes instantly lit up. At that moment, I can feel her love for her baby. At that moment, I can see her hope for the future. In our region, millions of people are suffering from different kinds of disease and poor health conditions. It's the duty of the regional office to work with members together to build an equitable, safe, innovative, and collaborative future for the people. Ladies and gentlemen, it will be a privilege if I have the opportunity to take up the responsibility of leading the regional office. I'm ready to devote myself to the lofty aspirations of the people of our region. I sincerely count all your strong support. Let's walk our talk to ensure deliverable results and work together for a better future for Western Pacific region. Thank you.
Thank you, Dr. Song. We will now continue the interview with question and answer. I will now pull the first token with the name of the regional committee member, which express the wish to ask a question to Dr. Song. I shall now give the floor to the Philippines to ask their question.
Good morning, everyone. And thank you, Dr. Songli, for your presentation. I would like to ask, what would you do? Because in your presentation, you did not mention regarding tobacco use. I would like to ask, what would you do differently to control tobacco use? Thank you.
Thanks for your question, a friend from Philippines. About the tobacco use. Yes, in our region, this is the high risk factor for NCDs. And according to WHO estimation, our region is a home to 1/3 of the world's smokers. Yeah, it is estimated that 2 people in the region die every minute from a tobacco-related disease. So according to the WHO resolution, the member states take actions together for the tobacco control. And in our region, many countries have made a lot of progress. And I know for tobacco control, need the multi-sector cooperation to work together, and also need high-level advocacy and to have mobilized more resources to work together for the tobacco use. And also, we know for the individual, the behaviors changing is another the issue. So we need to build a broadened partnership with the community, the health workers, and work together, and also the social workers and the health education, health promotion to change the individual's behaviors. And for adolescent, the earlier to prevent the tobacco use is also very important. So for our region, we have a lot of the work needed to do. For regional office, need to work closely with member states from the legislation and policy making and the national strategic making together, and high-level advocacy for health promotion and health education. So to reduce the tobacco use, for example, the marketing administration and the some other the administration departments to work together. Thank you.
Thank you very much, Dr. Songbi.
I shall now give the floor to the USA to ask their question. Dr. Song, you now have the floor. Please ensure you complete your answer within 3 minutes. Yes, United States of America. You have the floor.
Thank you, Mr. Chair. Good evening, colleagues. Thank you for this opportunity to ask a question of Dr. Song, and thank you for your presentation. We found it very helpful. So Dr. Song, if elected, how will you build trust with Wipro staff, promote an ethical and equitable culture, and exercise sound management practices to ensure that there is enhanced accountability at Wipro? Thank you.
Thanks for your question from the American friend. You mentioned about the fairness, and I think it is very important for the regional office to build the dialogue, the channel with the member states and partners together. It's very important. Just as the Talanoa spirit, it means listen, consider, and make consensus. So the fairness environment building is vital for all member states to involve in the regulation of our region, such as the regional committee, the annual meeting. It's the vital meeting for every member states to express their voices. And for the governance, the efficiency is vital. So one hand, we can empower the member states and empower each and every staff in the office. On the other hand, it is very important for the performance evaluation. And WHO have the staff regulations in line with the WHO's standard procedure and transparency procedure. It will be helpful for improve the efficiency and build a respectful, inclusive the culture. Thank you.
I shall now give the floor to Republic of Korea to ask their question.
Morning, everyone. Thank you for your presentation, Dr. Song Lee. So I appreciate your strong commitment to the work of Wipro. You may already mention partly about my questions, but I want to get clear reply from you. If we were to be elected regional director, what would you like to do during your term? Please suggest 3 important and imperative things. It's like a priority you would like to do, especially in terms of health reform and internal management too. And how would you address and achieve those things?
Dr. Song, you have the floor.
Thanks for your question. Thanks, friends from Korea. If I will be elected, the priority first is equity. Among our region, there are the diverse circumstances and different developing status among different countries. There is a big gap among different countries. For example, our region, the life expectation is about 77.7 years old in the year 2019. Some developed countries, the life expectation is above 80 years old. But for several countries, the life expectation is less 60 years old. Another example, for the polio immunization coverage among 1-year-old, it was 95% in our region. But several countries, the polio immunization coverage less than 50%. So I think the region office needed to do more high-level advocacy and to build broadened partnership and to mobilize more resources to support these developing countries, especially island countries, to meet the needs of the unmet. And another priority is cooperation. For our member states among our region, we need to work more closely for our same goal, for a healthy and safe region. So I think it is vital to build more channels, platforms, mechanisms for experience sharing, practice knowledge exchange, and to build more channels and more broadened partnership to involve in health sectors. And for the capacity building is another very vital issue. especially to strengthen the health systems according to the climate change, to build a climate change resilient health team, and also for the next pandemic preparation response. Thank you.
Thank you, Dr. Sung-Hee.
I shall now give the floor to the friends to ask their question.
Est-ce que vous pouvez m'entendre?
Can you hear me? Thank you very much. Thank you, Dr. Song-Lee, for your presentation. The world health architecture is evolving quickly. What do you think the role of the regional office should be or could be in the effort of collaboration between various actors, such as vertical and cross-cutting technical partners, such as the World Fund and the Fund Against the Pandemic? Do you think that WHO should take the initiative in this regard? And if so, how do you envisage the role of WHO? Thank you very much.
Dr. Song, you now have the floor.
Thanks for your question. For WHO, globally, it has the leading and coordinating role for public health and global health. The mission of WHO is to promote health and help the world safer and serve the vulnerable. Focus on global health and the public health. I believe WHO is taking the leading and coordinating role all over the world. For regional office, have the same role for the public health and global health to convene member states to work together to combat against the disease and pandemic. So with different partners, there are different mechanisms, such as the intergovernmental mechanism and also other UN agencies and non-state actors. The actors have different roles. For WHO, the leading and coordinating role in public health and global health, and have a broadened cooperation to have more involvement with the global development. As we know, the SDGs, so the Sustainable Development Goals, the SDG 3, is the main goal that the WHO have the leading goal. And according to other SDGs, for SDG 4, SDG 5, the education, the gender equality, etc. So WHO can have a more involvement for the global sustainable development and have more contributions and have a more gender perspective and have a broader partnership with education department and other departments. As we know, the health issues beyond health, so for WHO, have more high-level advocacy and broaden partnership with other UN agencies and non-state actors and intergovernmental mechanism to work together. Thank you.
Merci, doctor.
I shall now give the floor to Vietnam to ask their question. Vietnam, you have the floor.
Yeah. Thank you, Chair. Good morning, everyone. I would like to ask a question to the Chinese candidate. If you are elected as a regional director and you have to lead many countries in the region, what is your international work experiences that can support for your work? Thank you.
Dr. Song, you now have the floor.
Thanks for your question. About the international experience, last 20 years, I have involved in the global partnership for UN Every Woman, Every Child, and also involved in a lot of partnership with WHO, UNICEF, UNFPA, World Bank, work together to implement a lot of projects. And also, I'm the member of the Strategic and Technical Advisory Group of WHO. From my working experience, I sincerely believe to build a broadened partnership is critical to achieve our common goal, the health promotion and improvement for our population. And if I will be elected as the RD, I will launch the initiative for high-level advocacy and to attain the political commitment for more investment for health. It is vital for our health sectors to get more resources and get more support from other agencies, other partners, especially for our region. There is a big gap, the diverse the situation. So it's vital to have high-level advocacy to mobilize more resources to support health sectors, to strengthen the capacity building. From my experience, the prevention of mother-to-child transmission of HIV, syphilis, and hepatitis B. The WHO Goodwill Ambassador for TB and HIV, Professor Peng Liyuan, the First Lady of China, we invited her to attend the activities for caring the children, the orphans, the families. She always dedicated to bridge the policymakers and those vulnerable populations who are affected by disease. So if I will be elected, I will use my former experience for high-level advocacy to attain the more political commitment to work with a broadened partnership to work for our goal to improve populations' health. Thank you.
I shall now give the floor to Malaysia to ask their question.
Very good morning, and thank you, Dr. Songni, for your great presentation. I have one question in Malaysia. Would you think what are the components or areas within BIPRO that you think needs a substantial assistance and technical support in? Thank you.
Dr. Song, you have the floor.
Thanks for your question. Different regions face different challenges. For our region, the big gap among different countries. So to strengthen the capacity building for developing countries, especially island countries, is vital. And also we face many problems such as the NCDs, the mental health, the aging trend. Our region face a lot of problems. So I think according to different countries' specific needs and the special background, the regional office work closely with country offices and member states to make the national strategy and to provide the technical support according to different countries' the special situation. And in our region, there are different the developing status. Some countries have a lot of good experience. I believe the regional office to build a broadened mechanism, channels, and platforms for our countries in our region to share experience, knowledge, technology, and also to give support, especially the technical support for our member states according to their special needs. And for WHO, a very vital role for the strategic planning according to the member states' situation, and also for the capacity building and give the technical advice. Some countries facing the aging trend and some countries face the NCDs, and for our region together to face the pandemic, the preparedness response. So the above issues need a regional office to provide the technical support according to a member state's needs and the special situation to work closely to provide the strong technical support. So the technical advisory group building is also very vital for our region. Thank you.
Thank you very much.
I shall now give the floor to Solomon Islands to ask the question.
Thank you, Mr. Chair. Let me thank Dr. Song Lee for the presentation. My question, if you will provide examples from your previous or current work of mitigative measures outside of the direct health arena that will impact on the social determinants of health. Thank you.
Dr. Song, you now have the floor.
Thanks for your question. As we know, the MDGs and the SDGs have the core indicator about life expectation, maternal mortality rate, and under 5 mortality rate. From my working experience, over 20 years in MCH field, we mobilize a lot of resources to strengthening the MCH service providing from mothers and babies. And according to the high-level advocacy, the MCH has been taken as a priority of the National Development Plan of China. And as the National Council, there is a working committee for women and children. The women's health and children's health as the priority of the working committee under the National Council. In the last 20 years, we have a very good partnership with the Ministry of Finance and the Ministry of Development and Reform. So we mobilized a lot of investment for strengthening the MCH health system. And also the primary health care provide the essential package for mothers, prenatal checkup, and the children's checkup. I remember very clearly 20 years ago, the hospital delivery rate was less 50 among China. But now, in rural areas, the hospital delivery rate has been enhanced above 99%. So the maternal and mortality rate among the rural area and the urban area has been narrowed greatly. So to strengthen the health system, especially primary health care, and to prevent the financial hardship for those families, that's the goal, or to achieve universal health coverage, to provide accessible, affordable, quality health care for our people. That's our common goal. Thank you.
Thank you.
I shall now give the floor to Japan to ask the question.
Okay. Thank you, Chair. Good morning, everyone. I would like to ask Dr. Song Lee about the aging policy perspective. We recognize that many countries in the region will experience accelerated aging in the near future, and that countries that have not yet achieved universal health coverage will face a double burden in addition to improving the health levels. We would like to ask you about your views about the measures you intend to take when you become the next RD. I thank you.
Dr. Song, you now have the floor.
Thanks for your question. Aging is a trend of our region face. According to WHO estimation, more than 245 million populations above 65 years old in our region. And this number is expected to be doubled by 2050. If I will be elected, the issue, I think it is vital to build an elderly-friendly society, elderly-friendly community, and elderly-friendly hospital. I sincerely believe elderly doesn't mean the weak, the sick, the disabled. If we can take strong, comprehensive measurement, we can turn the elderly from the silver into gold. That need the transformative, the measurement. And the aging, I have some issues with NCDs together, just as you mentioned, the double burden for some countries. So prevention is better than treatment. And the primary health care needed to be strengthened to provide the integrated, the people-centered, the comprehensive and continuous health service for the elderly. This is a life course issue. Yeah, from womb to tomb, from the start point of life to the end of the life course. We need to build a life course process and a coordinated the mechanism to take the strong measurement. So this is the health awareness improvement process, especially to provide a continuous health service from prevention to treatment to rehabilitation and palliative care for elderly. Thank you.
I shall now give the floor to the New Zealand to ask the question.
Good afternoon, colleagues. Thank you, Dr. Song Lee, for your presentation. You have actually answered quite a few questions that we had on our list, but I'd like to take this opportunity to ask you to please describe your qualities as a leader and how you would apply those as you come into the Wipro office if you were elected. Thank you.
Dr. Song, you now have the floor.
Thanks for your question. From my working experience, I always be respectful for my colleagues and staffs and respect to every individual's strengths. And I always can empower each and every staff to work together to attain the common goal. From my working experience, innovation is another driven that I always pursue. I remembered the 15 years ago when I visited a village, I met a pregnant woman. Yeah, I know she was waiting for the HIV testing. She said she had to wait 2 weeks. So when I knew the news, I immediately to have an extensive consultation with the experts, international experts and the national experts. If we can take the rapid test for the pregnant women so they can get the result as early as possible, so they can get early diagnosis and early intervention. So immediately later, after our discussion with experts together, we revise our national strategy plan and to use the rapid test for the pregnant women for HIV test. That's one characteristic. And I have great passion for the health population's improvement. And also from my working experience, how to reduce the gap among different regions and areas is always my goal. So after 20 years in MCH, the MMR among the rural area and the urban area is nearly the same in China. I sincerely hope to devote my passion and serve for the vulnerable groups for our region. We face so many diverse situations and the big gap among our region. So I sincerely hope with our collaboration, innovation to reduce, eliminate inequity, and also keep safety. Thank you.
Thank you.
I shall now give the floor to Australia to ask the question.
Thank you, Chair, and thank you, Dr. Lee, for your presentation. It's great to hear your views on these issues. In the context of reforms underway through the headquarters to strengthen the WHO's organizational governance, what would your organizational reforms for WIPRO be? Thank you.
Thanks for your question. I noticed that WHO headquarters are implementing the transformative measurement. And for Director General, Dr. Tedros, and advocate that inclusive, respectful, and also the transparent working environment for our region. Today, the live forum, I think it's a very good reform to increase the transparency. And for the regional office in the future to create a respectful, inclusive, and transparent, high efficiency environment is vital to empower every staff, empower every member states to have more close collaboration among our regions. There are the diverse situations urgently need our solidarity. It's essential for our region to have the more innovative measurement and transformative measurement. And also, I sincerely hope our member states in our region can have more dialogues among the countries, member states, to work together and also have more close collaboration and more dialogues with the WHO headquarters. So we can implement the WHO global guidelines and strategies in our region, and also according to our region's the specific situation to listen to member states' voice, needs, and circumstances to build our regions, the capacity building mechanism, and a very good the green channel, the dialogue to improve the efficiency and to respect the different culture and background and different development the status. So it's essential for us to have more transformative the measurement, innovation, and collaboration. Thank you.
The total time for these interviews has been almost exhausted, just left only 27 seconds. Thank you very much, Dr. Song, for being with us today. You may now leave the conference hall, and we will now take a short break and begin again at 10:35 Philippine time with the second interview. Thank you.
Thanks, Chair. Thanks, everyone. Thanks for every friend. Thanks.
We shall now proceed with Dr. Jimmy Rocher, second candidate. Thank you, Dr. Rocher, for joining this interview today. Please proceed with your oral presentation of up to 20 minutes. You may do this standing at the podium or seated at the table. So you now have the floor.
Thank you so much, Chairperson of the RCM and members of the RCM, members of WIPRO that are listening into this broadcast. It is a privilege to be here to participate in this process. So thank you. So, Mr. Chairperson, let me first of all thank you as the Chairperson of the RCM, members of WIPRO, WHO Secretariat, ably led by Acting Regional Director Dr. Susanna Jacob, and your team for enabling all 5 of us to come and converse with you today. It's much appreciated. Before I speak to my vision and the priorities that I would focus on should I get this role, I would like to just reflect on 3 things that will influence how my priority setting will go if I took the role. And those 3 reflections, first of all, is that I consider this recruitment as not the normal end of tenure recruitment process of an incumbent regional director. Of course, you're trying to get the best candidate that will actually fill the shoe going forward, and of course, fill the shoe that the acting regional director is ably filling. And so, as an incoming RD, any of us appointed will have to have that in mind, that we are coming in part way through the process. And it's very important because the 13th work program finishes this year. The WIPRO strategic directions document might be ending next year. So it is a transition that I think we really need to keep in mind when we come in so that we can hit the ground running. The second reflection is WHO at 75 years old is a very well-oiled machine. It's guided by its vision that's enshrined in the Constitution, the attainment of the highest level of health and well-being for our people, encompassing SDG 3 very nicely, and delivered through your mission, 3 simple phrases: promote health, keep the world safe, and save the vulnerable, which are then translated and demonstrated through your 3 billions, linking very nicely. And driven by the 8 themes, which I think are a statement of intent on how WHO would like to do business going forward. It's an action-oriented theme. The third reflection is about WIPRO. It's one of the 6 regions, and as one of the 6 regions for the Western Pacific, WIPRO has the responsibility to implement WHO's global vision within our region. And therefore, WIPRO's long-term vision for the future towards the healthiest and safest region is aligned to the global vision of WHO, and of course aligned to the Constitution. It has a vision that I think is far-reaching. In my view, a vision is like a lighthouse. It's a goalpost that says where you want to go. And then it helps you decide what you do in order to get there. It has 3 themes in the current strategy. We work for the future. People and countries drive what we do. And concerns about the future unite our region. it focuses on 4 strategic priorities, which will, in my view, continue way into the future and will only increase in some of them. Health security, including antimicrobial resistance, NCDs and aged care, climate change, environment. That's close to the heart of the people from where I come from in the Pacific, but not just the Pacific, also in the rest of the WIPRO region. Reaching the unreached. And I think that is something too often said, a little bit difficult to achieve, but it is in your vision statement. And I think it sets the agenda for WIPRO to push towards that. So having done that reflection, and this reflection is important because if I happen to come in as an RD, I would need to make sure that my mindset is linked on to what is current, to linked on to make sure that the good things that are happening are progressed and strengthened, to ensure that where there are gaps, they are bridged, and to make sure that the mode of work is to involve members, the staff, and partners to map that out for us. So what is my vision? I guess the first thing to say, Mr. Chair, is that I fully subscribe to the current vision because it have a future date of a region that we want to see. I would suggest that we put some sort of a time to it so that monitoring it becomes easier. Is it the safest and the healthiest region by 2100, or is it by 2050? Because that then help us set the strategies to get there and what we need to do to achieve it. So I would probably suggest that. I would also suggest that perhaps we could enhance the vision by bringing people into it. At the moment is a statement about the region, but I would suggest, for instance, a wording such as for the future, towards a region where its people are empowered, they are united, and they work together to become the healthiest and the safest region. So it links the vision to the people and how we get there. But Chair, I would suggest we need another vision. And that vision is for the organization, for WIPRO. I think it's not common, but in my previous life, I worked for the largest technical agency in the Pacific, and we found it useful to have a vision for ourselves. It gave us the discipline. We were an entity. It was something our staff identified with, and especially when we go through challenges, they look back on the vision of the organization, and they're part of it. And I would suggest that the vision might read something like this: a highly professional, dynamic, innovative, respectful, inclusive, and caring organization. That's the part that deals with the organization, whose staff are empowered, they're respected, valued, and they work in genuine partnership together with its members and other partners to deliver excellent services to achieve the healthiest and safest region. So this is where we link in the organization, and it sets the parameters for the management of the organization, the people working there, that is the organization they represent. And when they go out, they are ambassador for that organization to our countries. And it helped discipline, it helped bring people together. So that would be one thing, Mr. Chair, that I would be proposing that we include for our region. The current WIPRO document has 3 themes. And I think the themes are very well stated. I would again look to enhance the themes, not to change them, because I think they're set in very good place. So the first theme was about, work for the future. I would suggest to enhance that, I would propose a narrative, lessons of the past, the realities of today, and the forecast of what challenges and opportunities to come. They set the platform in which we plan the future direction of WIPRO and our member countries. We look back, we look to now, and then we look forward. Secondly, the theme is perfect. I wouldn't change it. But the third theme, I think, would be useful also to enhance. The third theme is about when we face challenges, the region unites. I would want to bring in the strategic priorities into the theme. And I would suggest unite and work together to maximize health security, including antimicrobial resistance, to address non-communicable diseases and aging, to address health impacts of climate and environmental change, and to reach the unreached. We can do this through unity, and I think we need to put it in our theme and also re-enhance it in our strategic direction. But I would add a fourth theme, and the fourth theme is something that we talk about quite often, but in my view, we haven't really done a deep dive to address the solutions. And this is the social determinants of health. And my fourth theme would simply read, unlock the health benefits from the social determinants of health that exist outside the health sector. I note the future thoughts in our document is to try and influence health outside of the sector. And it's almost like a standoff, that there are people outside the sector that want to get involved. And there are people within the health sector that want to go out, but the road has not really been constructed. And it's my view that after years of talking about it, WHO really need to take the first step and look at developing a very specific strategy which is innovative, that works and pulls together those outside. This is an area, Mr. Chair, that I bring some experience in. I worked at the regional level, at national level, doing exactly that. And so I think developing a strategy for that is going to be very, very important. Those are the visionary type. Now, what are my priorities? I would suggest 5 priorities that I will focus on. The first one is focus on the organization and its people, its work environment, and its systems. So that's priority 1. And that has a few sub-priorities I will come to. My second priority is focusing on the members. And what is it that we can do on the members? My third priority is the WHO work plan. And then my fourth priority is how do we operationalize social determinants of health? And my fifth priority is basically to look at financing. We rely on the regular budget. We sometimes have XP, but I think it's time that we actually look at a more sustainable financing mechanism that augment the WHO regular resources. So priority number 1, focused on the organization. That's another area I bring quite a lot of experience, Mr. Chair. I oversaw the reform in the Pacific of the largest agency, absorbing 2.5 others. There were plenty of challenges there, so I've lived with it, I've breathed it, I've looked at solutions, we've established best practice models in dealing with those. And I'm not saying I'm an expert, but I do have some experience that I might bring to the table on that. So in the work environment, in the organization, there are 4 subparts. Work environment, one of the first things that I will probably want to do is to just understand the work environment within our office. Is it conducive? Is it positive? Are there restrictive areas? Are there limitations? Because if there are, it is important to unlock those. Why? Because we need our staff to be able to deliver, and they need to work in an environment that is conducive. My second is the staff. I would engage with all staff to understand issues. What are their hopes? What are their fears? Are they satisfied? I would look at giving them assurance, confidence that they have the respect of each other and the organization. I would look to increase interactions through more regular meetings with staff. In my previous life, an organization where we have 700 people, 300 at headquarters, I routinely do every quarter a full staff meeting, and if need be, more regular. I would do every month a staff meeting of different divisions, just to make sure that they are part of that process. That's something I think that would be quite useful here. The third area I would look at is strengthening policies, processes to protect and empower and give staff confidence. For instance, I know the system of reporting and responding to misconduct, harassment has already been started. I would further enhance that. I think that is key. Streamlining internal processes to put in place recourse for staff. There will be some staff that says my organization has not really looked after me. They need to have a recourse that allows them to actually bring the issues up. And we've done this in other organizations. The fourth area I would look at is strengthen other policies and systems. And that's administrative and financial. some technological platforms are giving us much cheaper airfare prices than the traditional 30 to 40%. That kind of savings would be useful for WHO to apply elsewhere. I would look at representation of member states in WIPRO. And this is not about the numbers. This is about equity, that all 37 members of WIPRO who own WIPRO need to have a say or a presence. And I think that is something that is very important. And as I said, not numbers, the equity consideration. I would look at enhancing collaboration with other WHO regions. Now, of course, we already have systems in place, and I may be wrong, but some of the systems are a little bit tricky to get through because of the way that they are structured. I would look at enhancing partnerships with key stakeholders, ADB, World Bank, APOMA. I used to be with APOMA as the vice chair and had some difficulties in linking with WHO from APOMA, and we are both trying to look at malaria. So I think we can streamline how we work there. Now, increased focus on members. I have sort of two sub areas. The first thing on members is that they benefit from WHO programs. These come from the 13th Work Program of WHO and the region strategic focus. And therefore, the first focus is to make sure we revalidate these priorities. And revalidating them to make sure that they are ongoing. The WIPRO vision document, I don't know, it might end next year if it's a 5-year document. So the RD will have 1-year transition to come in, have a look at that, to assess what goes on, what the gaps are, and to see and consult with the membership. Challenges in the region will continue. NCD is now the biggest killer, at least in the part of the world I come from. 70 to 80% of all deaths is due to NCDs. There's a fear, although climate change is the most important thing that is talked about. In some countries, NCDs will actually kill more people before climate change sinks the island. So I think it's very important that we have a balance. We push the climate change in the Pacific, but we need to lift up the emphasis on NCDs. These are the two important areas we need to look at. I would seek member views on the vision that I'm proposing for the organization, visit countries to revalidate, strengthen WHO presence and programs in member states. But there are two things I'd like to also focus on: a dedicated program to increase numbers of professionals from smaller countries that may ultimately be able to serve at WHO. I would also like to explore twinning programs between bigger countries and smaller countries, so that a large country may, for instance, adopt or twin with a smaller country and say, look, I'll work with you. I'll take you on the journey. There are aspects of what you need that I can provide. Some of this is not money, it's technical. And I think if we are able to have a region where the countries can unite, that gives us an edge to move forward. Now, unlocking the determinants of health. Most talked about, but we all know 70 to 80% of health outcomes exist outside the health sector. Put simply, even if we achieve 100% of our programs in health, we still fall short of the health outcomes this world needs. And therefore, developing a strategy, as I've outlined earlier, is going to be a key focus. Innovative XP financing strategy to make sure that we have a sustainable extra budgetary support to augment and complement our limited budget. I think for a region of 2 billion people, we might get around 10% at the moment of the total resources of WHO. Don't quote me on that, but just from memory, it's about 6 billion budget of our biennium, about 600 million for this region, comes to about roughly 10%, 2 billion people. Luckily, many of the countries here are not receiving services. They are donors. They are supporting us. And I think they'll be very important that we look at the innovative financing strategy. So, Chair, in summary, I hope I would contribute to the following outcomes at the end of my term if I got appointed. A region that is healthiest and safest. A region that is empowered, united, work together, and supportive of each other. A region where the larger and richer members can partner with the smaller to support them in their development aspirations, a region that can stand to support other regions, and a region that is happy with their WIPRO office. It's very important that this office is something that the regions look to as their pearl. I would also look at an organization that is confident, disciplined, innovative, inclusive, caring, and where its staff are valued and secure in their work. An organization that is well-resourced with staff and people, that has institutionalized innovative modality of financing to supplement the WHO resources. An organization that has unlocked and demonstrated the benefits for strategically engaging on social determinants, and an organization that its members can be proud of. Finally, I'd look at a staff that is competent, committed, secure, happy to serve the organization as its members and as the ambassadors of the organization. In conclusion, WHO will continue to be needed. Its vision now for the Western Pacific region provides us a platform to launch into the future. And that will be something that we can face with confidence because we can continue to improve. And I believe my experience of having successfully led and reformed the largest technical agency in the Pacific and scientific agency, covering more than 20 sectors, as is in my profile, will enable me to deliver and lead our region here in WIPRO. Thank you.
Thank you, Dr. Rocher. We will now continue the interview with question and answer. I will now put the first token with the name of a regional committee member, which express their wish to ask a question to Dr. Rocher. I shall now give the floor to France to ask their question.
Merci, Monsieur le Président. Merci beaucoup pour
Thank you, Mr. Chair. Thank you for your presentations, Dr. Rogers. Here's my question. The World Health Architecture is evolving rapidly. What do you think would be the role of the regional office in the coordination of various partners, such as cross-cutting and vertical partners, such as the Global Fund and the Global Fund for the pandemic response? Do you think that WHO should take the initiative in this respect? And if so, how do you see that role? Thank you.
Dr. Rocher, you now have the floor. Please ensure that you complete your answer within 3 minutes.
Thank you, Chair, and thank you, Delegate from France. As I have indicated, partnership is crucial to address cross-cutting challenges. Many of the independent agencies have their own rules and procedures. So WHO will not be able to just go in and take over a program that belongs to another organization. However, WHO has had the history of working in partnership with these organizations. What I would propose, I guess, is that these larger international agencies partner with the specialist agencies within the region that they work in so that they can have the best benefit of spreading out the resources that come from the agencies, like the Global Fund, for instance. As an example, WHO helped us in developing the first ever submission to the Global Fund that I was leading in the Pacific, and that was very successful. Global Fund used WHO, and I think that's really the modality that we need to go on. Thank you.
Thank you, Doctor.
I shall now give the floor to Republic of Korea to ask their question.
Dr. Rogers, thank you for your well-organized speech. So my question is about compared to other regions, the Western Pacific region has diverse and cultural background and levels of socioeconomic development among its members. You said already it's one of your priorities, member states. Please explain how would you facilitate collaboration or coordination among the member states, especially resource mobilization or communication?
Thank you, Delegate from Korea, for that question. I briefly alluded to partnerships in my presentation. I think it's accepted that we have members from different development status in our region. There are members that do not benefit from WHO services, but rather support and help finance WHO services beyond the regular budget. And there are members who truly need WHO services. I think the important part of the question is how do we engage our countries to be closer together, to link in and be able to talk to each other more. And I think at this point in time, that is usually left to meetings rather than a strategy that actually help them to reach out to each other. And that is one of the things that I made in my presentation of in the next 4 years or 5 years, if I was in this role, is actually to develop a strategy, a partnership that pulls our region together, where each member may have another member they work with or other members that they work with. Resource mobilization, we don't have equal capacity in the Pacific. Many countries do not actually have the capacity to raise funds. Some countries do not have capacity to implement big funded projects. And therefore, I think it is very important that we look at capacities when we look at areas like financing. But one of the key things that this region can do very well, I think, is to come together and look at each other's needs and help each other address things like, for instance, our response to pandemics. I think that's a very good example of how the region pulled together. Not just the region, but the technical agencies that pull together to help smaller countries or countries with less resources to be able to address the effects of, say, the global pandemic or even local epidemics. So I think the key is to work with our members to expand the scope of working together so that we can actually achieve our goals. Thank you.
Thank you.
I shall now give the floor to Malaysia to ask the question.
Hello. Okay. This is a question from Malaysia. We are actually amazed hearing the people-centered visions from Dr. Jimmy, right? So if you are voted as the next regional director, okay, how would you address the different level of acceptance in the region, looking at the diversity of our region, the member states in this region, in addressing the most common issues, the mostly talked issues, which is the INB and the HR amendment.
Thank you. Thank you.
Thank you.
Dr. Rocher, so you have now the floor.
Thank you. Can I ask the delegate just to repeat the last part of your question, please, with the acronym, if you wouldn't mind repeating that.
Our question is, if you are voted as the next regional director, how are you going to lead or address the different level of acceptance in the countries in this region in regard to INB, which is the intergovernmental negotiating body and also the amendment of the international health regulations, or in other terms, the pandemic treaty. Thank you.
So much for repeating and clarifying the question. I think it's very important that our region notes that we are at different stages of development. We are also come with different capacities. So for instance, in Solomon Islands, we have one person dealing with the IHR, but he's also dealing with multiple other things. And so in addressing that, I think I would look at it from two perspectives. One is understanding the governmental processes, because each of us have our separate government processes, but the other is to understand the capacity. And when it comes to issues like these amendments, it's very important for WHO to have a look at assessing what the capacities are in these countries and how WHO might be able to assist those countries directly. Or, coming to your question, this may be an area where we can have South-South cooperation between countries in the region, something I've alluded to, where expertise from our other countries will actually be very helpful to assist others that don't have the capacity or the prerequisite expertise to move forward. The key thing, in my view, is that we need to actually be on the same page. It's much more important where there are things to do with international agreements where we need to be on the same page. That needs to have a mechanism that brings our countries together. And I think that is something that WHO would be very, in a very good space to do, because it's already something they do. But this is where priorities will push the agenda to enhance and facilitate many of those areas. I think the final point to make is that countries of our region have a tradition of actually helping each other. And this is an area that I think will be very positive for WHO, because that's something we will enhance further. But as I reflected earlier on, it could also be something that some of our countries building their relationships could actually do in partnership in a bilateral South-South cooperation mode. So thank you.
I shall now give the floor to New Zealand to ask their question.
Good afternoon, Dr. Jimmy. Thank you for your presentation. As you well know, the regional director role has never been held by a national from a Pacific Island country. Can you share with us what you think a Pacific regional director would bring to the table that differs from the other candidates? Thank you.
Rocher, you now have the floor.
Thank you, New Zealand, for that question. Yes, I think maybe I could just preface that by saying that whilst we have 37 members in WIPRO, and quite a large number of the 37 is from the Pacific, when we look at the population of the Pacific, of that 1.9 billion in WIPRO, we are less than 1% of the total population. 99.4%, I think, of the population is from WIPRO. But the question relates more to what might be different from a Pacific understanding. I think what might be different is coming in from a resource poor sector in our region that is actually looking to make sure that efficiencies, effectiveness will drive the agenda, innovative mechanisms to drive change of agenda or change of resource mobilizations, as I've highlighted, I think will be things that are closer to the heart of a Pacific candidate, because we come from a perspective where we need to be innovative in order to get resources to help us to expand, to grow. I think the focus on the priorities, as I've highlighted, the vision is good, but I think is enhanced to actually link the vision to the people. I think the strategic priorities and the themes to link them to the people and to outcomes, I think is something that is important and I think could be driven by us. I think looking at areas like NCDs and climate change. Climate change is already on a pedestal, and I think we just continue to do that. However, I think that the NCDs need to be brought up because many of our countries are in danger of losing their intellectual capability that will help them plan combative measures against climate change. So we don't want that to happen, and I think we need to step up on that. One of the thoughts, I think, that we now have specialized funds for certain things. For instance, the Green Climate Fund is very difficult to access by countries. It's a very, very good mechanism, but it's almost impossible for some countries to access. So one of the things we need to have a look at is how do small countries or poorer countries have a better way of accessing global funds. I think the Global Fund for Malaria, HIV and TB is an example of how they've transformed success, but the others are more difficult. And I think someone coming in from the Pacific with the issues of having tried to drive efficiency would probably add that to the agenda. Thank you.
Thank you, Dr. Jimmy.
I shall now give the floor to Philippines to ask their question.
Thank you, Chair, and thank you, Dr. Jimmy, for your presentation. I would like to ask, how would you address the shortage of health workers in the region? Based on your presentation, one of your priorities would be regarding the staff. Thank you.
The Rocher, you now have the floor.
Thank you, Delegate from Philippines, for that question. I think you hit a very core point on our fight to improve health in all our countries, and more so in the Pacific. There are certain things, I think, that are not within the control of WHO. And WHO's side is to help develop capacity. But even where capacities are built, in some countries, including mine, the ability for the person to be engaged as a worker in the health ministry is dependent on the Ministry of Public Service that have limitations on funding. So I guess the issue for us is twofold: assessing the correct level of workforce that is needed to deliver health services, and not just the correct level, but the correct mix of skills that will provide the coverage to the kind of health challenges that are presenting in any health facility. And then asking the question, of course, do we have the total coverage? Do we need to build a better mix of skills? Once that is done, and of course we train people up, next question is, are we able to employ them within the government system? And this is where all governments really need to look deeply. And I guess the question for them to ask is, what kind of health service, what kind of health status of population do we want to have going forward, say, for instance, the next 10 years? And what does it mean? How many more staff do we need to help us get there? And I think many countries will need to come in to start looking at a workforce planning concept that is based on health outcomes that they would like to achieve over a number of period, and then start to work a strategy on how we fill the positions of those health workers. WHO would be able to help countries determine that path. But the actual employment of health workers really falls on government. So my focus will be to work closely with governments, to the authorities that employ people, and to the ministries that control financing, to partners that will be able to support increased workforce for a shorter period, and have them in a roundtable situation that unless we move with the appointment of people that will help the country address health services, will continue to fall behind. And as we continue to fall behind, we continue to put and leave people behind, because we are never ever going to be able to catch up. the population grows, the health challenges grow. I think it is very important that not WHO can set the parameters, help with countries, help mobilizing. At the end of the day, governments will need to take the responsibility of actually putting in place the positions to be able to help. Thank you.
Thank you, Dr. Jimmy.
I shall now give the floor to United States of America to ask their question.
Thank you, Mr. Chair. Thank you, Dr. Rogers, for your presentation. We found it very helpful to understand your ideas and your vision. So, Dr. Rogers, if elected, can you tell us how will you build trust with Wipro staff, promote an ethical and equitable culture, and exercise sound management practices to ensure that there is enhanced accountability at Wipro? Thank you.
Dr. Rocher, you now have the floor.
Thank you so much for that question. I think it hits the very centerpiece of WHO's ability to deliver services to members. Staff that are content, that are happy, excited with the workplace, know their roles, are respected, valued, they work better and they will deliver. They have a mission to fulfill. And where work environments may not be conducive or where there are issues that are stopping staff from performing their best, that undermines performance of the organization generally. So I think there are certain things that I would propose to do. Some of them are already being done. And therefore, I think my role is really just to make sure that they are enhanced, they continue to be done. And in particular, this is some of the big ones, processes and strategies for reporting and addressing any form of misconduct, whether it's sexual or otherwise, any form of harassment, any form of inappropriate behavior. And one of the things I think that's very, very important is that there are several no's: political, cultural, religious. Those are areas that are sacred. And I think the organization need to acknowledge that. People need to acknowledge and accept the fact that we come from different cultures. WHO employs people, I believe, from maybe more than 20 nationalities, maybe more. The last organization I worked in, we employed people from 36 different nationalities. And therefore, that gives a different culture mix. But they determine the environment within the organization. We're going to respect all of them and have the opportunity to actually ensure that their cultures are not degraded. They are respected, but what we want from them being part of the organization is to also accept the fact that they have work to do that is determined by their contracting arrangements. So I think the key thing for me is to make sure we have policies in place that staff can rely on, that they know that they can fall back on, that they are committed to their work. It's very important that staff have a recourse, as I mentioned. There will be times when the staff just cannot find the solution in the normal way we do business. And therefore, I think it's very important that there are recourse mechanisms to address the issues of particular staff or group of staff. I think it's very important that we increase harmonious relationship between different groups of people working in an organization. Some tendency sometimes is people go into their different nationalities because of issues happen. That is something that is very commonly undermining organizational performance and will be a priority to make sure that that kind of practice is not encouraged and good behavior and practice is encouraged. Thank you.
Thank you.
I shall now give the floor to Japan to ask their question.
Thank you, Roger, for your presentation. we would like to ask you about health measures based on gender equality. We recognize that in some countries there are gender disparities in opportunities to receive health and medical care. We believe that it is necessary to take measures to eliminate disparities, especially in health issues related with gender. If you are elected as a regional director, what kind of measures you will take in this regard? I thank you.
Rocher, you now have the floor.
Thank you, Japan, for that question. In many of our countries in the region, they have adopted policies that promote gender equality. However, in also many of the countries, that is not demonstrated in the way that services are provided or opportunities are given to women and to girls. And so I think if I was elected to this role, one of the key things for me would be to engage at the high political level. That is something that I will find reasonably easy in the Pacific because that's the level I operate in. And the high political level, meaning heads of governments, ministers are responsible for gender, ministers responsible for employment. I think it's very, very important, again, at each national level that strategies are put in place to address gender equality and gender equity at the national setting. I think the WHO role in here is to continue to push the best practice, continue to be able to provide specific sound advice to countries on how they might be able to develop gender sensitive and or gender equality programs. But I think, again, it comes back to the national level where the regional director will play a very, very important role in linking and bridging that political interface. I think also within the Asian region, to work with organizations already in Asia to have a partnership that work with the members, their members, and see how the gender equality approach is taken. Having said that, there are some countries in the Pacific where we have more women in employment, senior positions than men. And I think that's something that is very, very positive. They are very proactive in doing that. And I think some of the other countries are trying to follow suit. But again, this is where culture needs to be addressed. And one of the other things I think that we need to look at is there are cultural phenomenon in some countries, and I'm talking about Melanesia, where traditionally women are not often given the role to be able to lead. And I think that's another area that the regional director might be able to work with the right authorities in countries and with other organizations that work in those countries and in those regions to start to have a dialogue that will enhance equality. There are policies on gender equality, gender equity. I think the key thing now is how does WHO assist in either reviewing or implementing some of this that fall within its remit, because some of it may fall outside of WHO's remit. Thank you.
I shall now give the floor to Vietnam to ask their question.
Thank you, Mr. Chair. I would like to ask a question that what should the regional health care system be strengthened for better preparing and respond to the global health issues? Thank you.
Rocher, you now have the floor.
Can I just check that the question is how can the regional and global health system be strengthened? Is that the question?
Yeah, and how should the regional health care system be strengthened for better preparing and respond to the global health issues?
Thank you. I think that's a very, very important question. My response will be as follows. I see the regional and international health system as an extension of the national health system, where countries are able to address things entirely on their own. They need less support from the region and or international level. But I think the reality in our region and in many of the countries in our region is that we do not have that capability to be able to identify and or respond to some of the global challenges that we meet. And so there may have to be a relook at the program that WHO has, and how can we be more specific in targeting areas of weaknesses or deficiencies in our member states where such support might be needed. So I think an initial point that I would look at is to assess what is lacking in those countries that would prevent them from responding on their own. Having identified that gap is to then have a look at what is needed to be able to augment that incapacity, and then come back on the WHO side. What is missing is what WHO can do. Because that question is important from the perspective that there may be other aspects of response that fall outside of WHO's remit, or that are better done by other partners within the region or international community. So strengthening it, in my view, is firstly understanding what the deficiencies are. Secondly is then identifying the solutions to those deficiencies, and then mobilizing from WHO's perspective what it is that it may be able to do. And I think, having said that, one thing that I think WHO is very good at doing is to actually conducting that overall assessment to identify all the gaps and the solution points. And then, of course, partners can come in to pick up what areas they can actually usefully do and what areas WHO will be able to do. And ultimately, how do we build the capacity of the countries that lack that capacity over time, so that they are able to respond to equivalent issues several years on, because we have been able to build the capacity in a way that is sustainable, and organizations like WHO move back and play a supportive role. Thank you.
Thank you.
I shall now give the floor to China to ask the question.
Thank you, Chair. Thank you for your introduction, Dr. Rogers. Recently, we come to understand that the WHO headquarters is doing some reform policy. In particular, in the regional office and in country office, there's a change in the link between the two offices. So my question is, if you are elected, what is your plan to balance headquarters, regional office, and country office, and how to improve the role played by the regional office? Thank you.
Dr. Rocher, you now have the floor.
Thank you, Delegate from China, for the question. I guess, firstly, my response is that I'm not yet familiar with the exact nature of the changes with headquarters and WIPRO and how that role changes. But what I can say is that if I came in as the regional director, the first thing that I will need to do is to understand the change. Work out what are the implications of the change, both from a WHO headquarters perspective and in particular for the WIPRO perspective, and look at what then is the plan to make sure that it engages. As I have mentioned, despite the change, WIPRO is one of the 6 regions of WHO. And I think that will probably, not seeing what the change is, but I don't think that probably will change. which means that WHO will still retain the overall global health standard setting and policy setting at the global level, and that WIPRO will probably still be the implementation arm for our region. And I think importantly is then to have a look to make sure that whatever actions that WIPRO take in alignment and or complement what is at the headquarters. I'm sorry, I'm sort of not knowing exactly what the changes are. My response will be how I would engage. So engage by knowing the change, working out what the implications are. There will be positives out of that. There may be some negatives, and if there are some negatives, how do we mitigate the negatives in a positive way to make sure that at the end of the day, the WHO mission of attaining the highest level of health for all is still maintained, and to make sure that the WIPRO mission for the future, toward the safest and healthiest region is maintained. And I think within those two visions, the mechanism of engagement, the mode of collaboration, the strategies used to enhance that cooperation and collaboration would be things that we will work at to make sure that we get the best outcome out of that. Thank you.
谢谢。
Thank you.
We shall now give the floor to Australia to ask their question.
Thank you very much. So thanks, Dr. Rogers. Our question relates to crisis management. Recent public health crises showed leaders may encounter unforeseen problems which impact the capacity of their organisation to deliver. As Regional Director for WIPRO, how would you draw on your crisis management experience to prepare for and respond to emerging crises?
Rocher, you now have the floor.
Thank you, Australia, for that very important question. I think our region is among the most vulnerable to natural disasters, which is one of the things that leads to crisis that we then need to manage. So I think the important thing is to know that we are not immune to events that lead to crisis that require crisis management approach. And probably that's the first thing to note, and noting that the preparedness then is something that every country will need to build in, and WHO in particular as the lead health specialized agency with a focus on helping countries respond will need to make sure that that its strategy to respond to countries to assist in crisis is up to speed, and its ability to reach out to other partners as a coordinating lead agency for health-related crisis is also up to speed and in place. And I think the recent crisis on the pandemic, COVID-19 pandemic, just shows how effectively WHO has been able to not only lead, but pull together resources, both technical and financial and materials from a range and host of partners, and then make those available, particularly in Pacific Island countries. And I think that is a strength that WHO brings. It not only leads, it can be a coordinating entity. I think the part that I would think that we can move one step further, and this is at least speaking from the Pacific, is the ability, I think, or the wish to have the WHO regional director engage at the political level in countries. Now, I cannot at this point in time say about the Asian members of WIPRO, but I can say that from a Pacific perspective, that is something that I think both the leaders in the Pacific would welcome. And barring protocol issues, it's something that I would probably look to enable to have, say, for instance, the WHO regional director being able to be present at major leaders meetings in the Pacific for agendas that are important for those countries and agendas that are important because WHO is actually leading the responses or the of those programs. Crisis management, I think, is something that is already present in all countries. They do it with different levels of efficiency, different abilities. I think that's another area where WHO can actually look at to see what is the capacity of crisis management in many of these countries. For some of them, that is headed by different ministries, not by health. And so we need to reach out to understand that and then see how WHO may be able to augment many of those. Thank you.
We have now exhausted all of the questions for Dr. Rocher, but there is still time remaining before the 60 minutes allotted for this interview have elapsed. In accordance with what we has been previously agreed, I will now open the floor for any regional committee members which have not yet asked a question and which wish to do so now. In this case, please raise your hand in Zoom. Yeah. I see none. No more. So, as I see no hand raised, the candidate is invited to make any additional statement you wish until the end of the 60 minutes. Dr. Rocher, you have the floor.
Thank you, the chair. Thank you, members of the RCM. Thank you to members of WIPRO and all those listening into this broadcast. It has been an honor and a privilege to be part of this process. We have full confidence in it, and I think we're looking forward to the outcome. I think all the 5 candidates are friends with each other, and therefore that is a very good position to be. We all know that you're looking for the best candidate. We respect that, and we just want to thank you very much for the opportunity to be here. Thank you.
The total time for this interview has been exhausted. Thank you very much, Dr. Rocher, for being with us today. You may now leave the conference hall. Please allow us a moment to invite the next candidate into the room. We shall now proceed with Dr. Saya Mayu Piokala. Thank you, Dr. Piokala, for joining this interview today. Please proceed with your oral presentation of up to 20 minutes. We may do this. You may do this standing at the podium if you wish, or seated at the table. You now have the floor.
Honorable Chair, Acting Regional Director, Ministers, Senior Officials, ladies and gentlemen. It's a pleasure for me to be here today to deliver my presentation about the upcoming election of the Regional Director. My presentation will be as per outline that has been given to us. First being the vision, second being my experience and expertise for the role, third, what I hope to achieve as Regional Director, and fourth, how I plan to deliver on the core mandates of WHO in the Western Pacific region. On the first issue of vision, my overall vision is for our member states to have improved health outcomes and strengthen health systems as key drivers of sustainable development. I will address my vision broadly in three parts. First part, WIPRO and member states. Second part, WIPRO within WHO. And third part is WIPRO and partners. It is my view that if we are able to address these components, we will be able to achieve our vision. On WIPRO and member states, WIPRO exists to serve member states, and my vision is for the members to embrace WHO as an extension of themselves and not be seen as an outside organization. And what will this look like? The importance of having good relationship that is based on trust, respect, where engagement is honest, and aim at win-win for all involved. WIPRO provides the support it can to member states to enable members to achieve results that are impactful. On WIPRO within WHO, and specific to WIPRO, my vision is for an office with positive staff culture and to create a good working environment where staff feel welcome, empowered, appreciated, and happy to be part of the team. There will be zero tolerance to any misbehavior. It's about rebuilding the office to be an office we can all be proud to call our own. More broadly across WHO, that we are an integral part of the one WHO, yet specifically address the regional and country needs. Global and regional alignment will be a priority. On WIPRO and partners, it is very important that we can work together with our partners. Health is often said to be a very crowded space. It is my view that even if we did all we could across all the partners that work in health, with all the money we have, with all the people we have, there will still be work to do. So it's not so much about how many partners there are, but how we work better together. The second part of my presentation will be my experience and expertise for the role. And I would like to address this from two perspectives. Why did I apply? And what do I bring to the role? And I would like to highlight three things why I apply for the job. Firstly, my belief in the difference WHO and WIPRO can make. My heart is in WHO, and I have seen the difference it makes on the ground. It is the main lead and coordinating authority of health and strongly support the global efforts to progress the health agenda and make it a priority in sustainable development. I am committed to support WHO as a leader at global health. The WHO has played a pivotal role in the region, and the WHO and member states jointly achieved a lot as the 75th anniversary of WHO demonstrated. This must continue, and the work needs strong leadership. secondly, my belief that our region is special and can lead the work of the WHO. Our region is a special one, and opportunities for regional action is not utilized enough. We have shown that we are leaders in important pieces of work. For example, involvement in Framework Convention on Tobacco Control, FCTC, and being the only region where all members are signatories of FCTC. Thirdly, believe that I have something unique to offer, and I believe I can bring unique expertise and experience to be able to do the job well. So what do I bring to the role? In the interest of time, I'd like to focus on three things. Firstly, my clinical and ministerial experience in health, internal affairs, and public enterprises. I have been a clinician for 28 years, a surgeon for 14 years, and a medical superintendent of the main hospital in Tonga for 2 years. I have been a politician for 9 years and have been the Minister of Health for 7 years. And during this time, working in a resource-constrained environment, I still involved in leading the work in country, at regional level, and at global level as well. At country level, during my time as minister, we have been able to put health on the national priority. This has implications for how it is addressed and funded as a discipline. We have put a lot of focus into health system strengthening, universal health coverage, and primary health care. If I can highlight a couple of wins, on human resources, Tonga has seen significant growth in the number of doctors trained and has among the highest numbers of doctors and healthcare professionals per population in the Pacific. On primary health care and universal health coverage, we have been able to significantly reduce oral health problems in school children with an effective preventative school program. At regional level, I have been involved at the Pacific Health Ministers Forum, and I am the current chairperson, and will host the next Pacific Health Ministers meeting in Tonga next week. We have harnessed the power of regional collective action in the areas of NCDs, climate change, and COVID, among others. At the regional level, at the WHO, I have been very involved as well, and was the co-chair at the regional committee meeting last year. At global level, I have been an executive board member and also a commissioner for the WHO commissioners of NCDs in 2018-2020. In addition, I have presented at WHA on ENSO, National Surgery, Obstetric and Anesthesia Plan. And I'm proud to say that Tonga has completed the first ENSO in the Pacific as per recommendation of WHA. In addition to my health portfolio, I have been also had the opportunity and privilege to have been the Minister of Internal Affairs, responsible for local community engagements, gender, youth, disability, and sports, as well as the Minister for Public Enterprises, responsible for state-owned enterprises and businesses. This has allowed me to gain valuable experience and insight in leadership of these important areas that have important crossover into the regional director role. The second unique quality I bring is positive constructive management style. I use what would be best described as a people-centered approach to leadership, where I involve my team in the decision-making process, but I'm still happy to make decisions when I need to. I have an easygoing personality and employ an open-door policy, but still practice firm and fair decision-making. Many of you know me already, and what you see is what you get. No layers to peel away. Thirdly is networking, partnership, and resource mobilization expert. I have a very strong networking base among development partners, technical agencies, civil societies, and other countries. I utilize this to assist with, among other things, resource mobilization. One recent example is we have secured support of 50 million top to rebuild a new hospital in one of our outer islands. Over my time as minister, I have increased the budget of the ministry significantly and can use my resource mobilization experience to bring in resources to draw attention to the need of members where resources are limited. What I hope to achieve as a regional director. The key aspiration I have is to shape the organization to be fit for purpose, to better serve the Western Pacific region and achieve the vision I alluded to at the beginning. I hope we will all agree that WIPRO needs a process of culture change for the office to be more effective in its work to supporting member states. And this is necessary, and we need to live up to the values of the WTO and fulfill our potential as WIPRO. Talking about culture change is easier said than done. We all know that. We also know that culture change takes time. So we need to be realistic with ourselves, that it will not be easy nor a quick fix, but I am confident that it can be done. I was thinking for a name for this effort, and I thought a good name would be Healing Hearts, a process where the result would be a regional office where staff feel they are part of the team, they are well motivated, they're well supported, empowered, and acknowledged. WIPRO regional and country offices have thousands of capable and professional staff. The focus needs to be internal in the first instance, because for us to be effective in helping the members, we have to be in a place where we can provide support in a meaningful way. Some of the measures we can implement are as follows. First, organization-wide training on existing policies, so staff are aware of what is available to them. We already have existing policies to address issues such as sexual harassment, bullying, domestic violence, etc. The challenge is living those good policies. And to address this, we need to ensure that training are carried out so all staff can use the policies as they were intended. Second is setting up a task force or working group to focus on staff issues and bring their views on board. The organization is a diverse one that represents the region. We already have an insight to many of our members through our own staff. The process where we can better harness the knowledge among staff will be helpful as we try and bring about culture change. Staff need to feel confident that they are part of the process and are being heard. Third, create a culture champions in each of the teams and offices. Champions are important in all change processes, and this will be an important part of the efforts to bring about the appropriate culture change. We need a functional change management group to lead the change that is needed. Fourth, I would like to clarify roles and responsibilities, delegation of authority, and further simplify the internal processes. It is not a secret, as we hear a lot about the heavy bureaucracy and red tape in the office. This must be simplified, as it puts a lot of pressure on everyone, takes away capacity from results and impact. We must move from compliance focus to delivering result focus with the right amount of oversight. We have to review the processes, simplify them, and make them more user-friendly. The last component I'll talk about will be to strengthen country offices by increasing their capacity, delegation, and funding allocation. There seems to be some underutilization and empowerment of regional, sub-regional, and country offices. One of the challenges for some of the member countries is the need to defer back to WIPRO for many issues, that we don't see the need to go all the way back to WIPRO. It would be helpful to look at what we can do to empower the sub-regional and country offices more, but of course still an environment that allows appropriate accountability. The last part of my presentation is how I plan to deliver on the core mandates of WHO in the Western Pacific region. My short-term priority, as I have alluded to, is creating an environment for people to feel happy and want to work for WHO. In line with the regional vision for the future adopted by RCM in 2019, there are 4 priorities: health security, including antimicrobial resistance, NCDs, and aging, climate change and environmental health, and reaching the unreached. In my view, what is missing here is the health system strengthening based on primary health care towards universal health coverage. COVID showed us the weaknesses of the health system, and services were interrupted. They need strengthening with particular emphasis on primary health care to focus on community and local needs and ensure equity. Based on the experience of the last few years, I would like to focus on the following priorities. First, healthy population to increase healthy life expectancy, and this would also address the risk factors: alcohol, tobacco, food and nutrition, physical activities, and other health determinants, social and environmental determinants, including climate change. In this area, a paradigm shift is required towards prevention and health promotion, and strong focus on determinants of health. It also needs investment, as currently a significant proportion of the current budget goes into curative care, and healthcare costs puts a lot of pressure on countries' economy. We should therefore start the continuum earlier and invest into essential public health functions to prevent the development of the diseases by health promoting program, health literacy, prevention, and screening program. Addressing social, environmental determinants and climate change is key. Second, health system based on primary health care, which is the cornerstone of universal health coverage. Primary health care should be our flagship program with increased capacity and funding reaching out to local communities, focusing on their priorities, also integrating some of the essential preventive and health promoting work. Primary health care should be adapted to the needs of each country and community. Oral health is an area that has shown to be ideally addressed with primary health care and will be an area of priority. The curative hospital care should follow the needs of every country. Access to health services and financial protection is a critical component of universal health coverage. Third, health financing is the other critical components that it must be well calibrated to avoid high out-of-pocket payment, which can lead to impoverishment of the population. Public funding should be considered as much as necessary for a balanced approach. Fourth is health workforce. This is a chronic issue in many places and is an important issue. Both availability of doctors, nurses, midwives, and allied health workers, so investment and incentives are required together with a career path to keep them. These priorities are consistent with the 5 priority areas outlined by Dr. Tedros to the Executive Board: healthy population, health system based on primary health care, health security, science and evidence-based practice, the WHO that is responsive to the needs of the member states. Lastly, I would like to briefly address the perception that I come from a small island developing state and whether I have what it takes to be a regional director. Do I think I have what it takes to run the office? Absolutely. When you are elected to be the regional director, you are the regional director for the region and all the member states. And you do your best to approach it in an even-handed way. Health is borderless, and COVID taught us that. We have to think about the region. It's about people. Leadership is always about the team. And I'm more than willing to play my part in, and I hope that what I have talked to already has shown you that I have the knowledge, experience, and empathy to lead the team at Wipro to take us forward. It can also be argued that what has been missing so far from Wipro is leadership from one of our smaller nations. And I sincerely hope that you will agree the time is right for this to happen. In conclusion, our region is a large, diverse region, and responding effectively is challenging. We need innovation. We need flexibility and close collaboration with member states. We share one goal, and that is better health for all. I believe I have what it takes to work with you all to take Western Pacific Region Office forward to achieve a collective vision, and hope you will give me the chance to do that. I thank you all.
Thank you, Dr. Pukala. We will now continue the interview with question and answer. I will now put the first token with the name of the regional committee member, which express their wish to ask a question to Dr. Pukala. I shall now give the floor to Vietnam to ask their question.
Thank you, Mr. Chair. I would like to ask a question that if you are elected, what challenges do you anticipate encountering in your role as a regional director?
Dr. Pukala, you now have the floor.
Can you repeat the question, please?
Please.
Okay. If you are elected, what challenges do you anticipate encountering in your role as a regional director? Thank you.
Thank you for the questions. As I have alluded to in my presentation, what is important and what I will encounter here is the management or the managing of the office of in Western Pacific region. As I have talked in my presentation, what is important that this is all about people, and we need to create an environment where this the staff in the office feel that they are appreciated, the good working environment for them to perform and serve the member states. People in the office, their role is to serve and listen to member states. The other challenge that I will encounter is the diversity of the Western Pacific region. We have bigger countries, we have small countries, we have high-income countries, we have low-income countries, and the challenges will be similar. The issue, the differences is on the scale of those challenges and priorities. But this is how it is very important that we need local solution. As I have mentioned in my presentation, there need to strengthen country offices and delegate authority where they can deliver better service to member states. We need to see better health outcome. We need to listen to people in the community, and we need to respond to them on a timely manner so that they will be able to achieve better health outcome as a priority for the member states. Thank you.
Thank you.
I shall now give the floor to Philippines to ask the question.
Thank you, Chair. And thank you, Dr. Saya, for your presentation. With your diverse experience, I would like to know on your strategy on how can UHC be achieved in urban slums of big cities.
Can you repeat the question, please?
Okay. So the question is, how can UHC be achieved in urban slums of big cities?
What's it?
I'll repeat again. So how can universal health care be achieved in urban slums of big cities?
If I may hear you right, how can universal health coverage be delivered in urban slums? Oh, yeah. Thank you. My apology for not getting what you're trying to say, but yes, as I alluded to in my presentation, COVID-19 has taught us the importance of going back to primary health care to achieve universal health coverage. And I'm saying this when I was a surgeon. I never believed in public health. I always think that operating is the way to go. But now I realize the importance of primary health care. Prevention is better than what we are tired of operating and amputation, food sepsis. So going back to the community is very important. So primary health care is key in this. To address the slum area in big cities, we need to get community engagement, community participation, and look at leaders around these areas where we can engage them. And those are the ones that will be a champion to run the primary health care. There is also an important, if we have problems with workforce, to have primary health care with prescribing rights where they can go to those communities and deliver. But they will still be under supervision from the district hospital. Also important, the community leaders around this area to empower them on primary health care, that we will be able to achieve universal health coverage. Thank you.
Thank you, Doctor.
I shall now give the floor to China to ask their question.
Thank you, Mr. Chair. So, in our region, the island countries are many and diversified. They are prone to climate change. So my question is, if you are elected how to promote the regional preparedness and a response in terms of climate change? Thank you.
Sorry that we cannot hear clearly the interpretation. Could you please repeat your question and check, please, Chinese channel?
Thank you,
Mr. Chair. In our region, we have many island countries. And these countries are challenged by climate change and natural disasters. If you are elected to this post, how do you plan to promote the preparedness and the response to climate change and the natural disasters? Thank you.
Dr. Piokala, you now have the floor.
Yeah. Yeah. Thank you. And the question on climate change, and this climate change affect small island developing states, including Pacific Island countries. The first thing that I will do is to look at the budget, what has been allocated by WHO to address climate change. I know the WHO cannot just do this alone. We need other partners to get involved with climate change. I know the Pacific Island countries are very vulnerable to climate change. Tonga and Vanuatu is one of those countries that is vulnerable to natural disasters. A report from World Bank that if you spend $1 on preparedness, you will save $7 in reconstruction after a natural disaster. So it is very important that we spend that $1 in preparedness. Addressing climate change, you have rising sea levels, coastal erosions, natural disasters. We need to build a health system that is resistant to natural disasters and climate change. So in addressing those issues of climate change preparedness, we need to seek other development partners like Green Climate Fund, World Bank to assist those small island development states with their preparedness. I understand that some countries like Tuvalu and them has been applying for Green Climate Fund, but it took a long time. But the time to act is now. So preparedness, we need to prepare not only physically, but the healthcare system to be able to cope if natural disasters hit. Climate change, for me, is a multiplier effect because post-natural disasters, what will come after? You know, the emerging vector-borne diseases, you don't have access to clean water and sanitation. Those are the things that we need to make sure that the health system that we have can address this. But we'll get other development partners to help countries, small island development states, in their preparedness for natural disaster and climate change. Thank you.
I shall now give the floor to United States of America to ask their question.
Thank you. Can you all hear me okay? Excellent. Minister Piokala, We appreciate hearing about your people-centered approach. And how would you work to further strengthen the relationship between Wipro and WHO headquarters? And how would you strengthen collaboration and coordination with other regional offices outside of Wipro? Thank you.
Piokara, you now have the floor.
Thank you, and I think this is a very important question. And I think what is important here that I talk about in my presentation is one, the WHO. You know, there needs to be a more interaction and interface between the head office, the regional office, WIPRO, and the country offices. That needs to happen. The interaction and the coordination between these, and this is very important. I think it is also important that the priorities and the framework from the head office, there has to be an alignment from the head office, WIPRO, and country offices. That has to strengthen. I know that there is a mechanism at the moment where the regional offices, they come together on a monthly basis to discuss issues related to the region as well as the WHO headquarters. But the bottom line is to translate all that is happening in the headquarters and the regional office to the country offices and the member state. I think that is the important. We need to listen to member states. Their priority will be different from places to places, but that need to be addressed. If we can't listen to member states, then the work of the regional office is not impacted on the health outcome of the member states. But I think it is very important that the three levels of WHO need to work together. They need to interact more, and the coordination has to be there to be able to serve member states better. Thank you.
Thank you.
I shall now give the floor to New Zealand to ask their question.
Good afternoon, Minister Piukala. Thank you so much for your presentation. Thank you also in your presentation for describing some of your leadership qualities. Be interested to know a bit more about what experience you have fostering and maintaining inclusive, respectful and safe workplaces and addressing misconduct, bullying, abuse of power and harassment, please. Thank you.
Piokala, you now have the floor.
Yeah, thank you, Sally from New Zealand. As I have alluded to my presentation, there is a concept in the Pacific called Talanoa. Talanoa is a widely used concept worldwide now, and it's just basically it's just a reflection where you bring people together at workplace, very inclusive, transparent, and where you discuss issues and you make decisions which is good for the organization. So working for WIPRO is working for people. This is about people. And we need to make them feel empowered, make them feel that they are well respected at the workplace. And we must make sure that we create a workplace that is safe for the staff. You must empower them, and gender equity is very important. I know that there is a presets policy that is in place, we need to enforce that. Training that so that the staff knows what is already there, what is the mechanism to protect their rights, you know, at the workplace. And I think that is a very important, what would I say, experience that I have. And I remember when our nurses back in Tonga, when they not happy about some nurses issue and they decided thinking of going on strike. You know, bringing them onto the table and discuss what can be done to address those issues. And I think I will use that Talanoa concept in the office that make, make staff feel that they are inclusive, the inclusiveness of staff, make the environment friendly, and know their rights, and zero tolerance for reporting of if something breaches of code of conduct within the organization. Thank you.
Thank you, Minister.
I shall now give the floor to Republic of Korea to ask their question.
Thank you, Dr. Sayer. So my questions may be overlapping, but you already emphasized the communication or collaboration with the member state. So please explain how would you facilitate collaboration or coordination among the member states, especially in terms of resource mobilization and information disclosure.
Can you repeat the question?
How do you facilitate collaboration or coordination among the member states, especially in terms of resource mobilization or information disclosure?
Yeah, thank you, Korea, for the questions. As I have discussed in my presentation, the importance of collaboration of member states from the Western Pacific region regional office. I think that is a very important component, and that is still exists now, that the work from regional office to member states is still on. And I think for me, I'll make sure that to continue that close working relationship between member states. Secondly, I think the Western Pacific region need to listen to member states. As I have mentioned earlier, the needs and priority is different from country to country. And that is why it is important that we strengthen the country offices to help Western Pacific Regional Office coordinate between those member states and the regional office that need a better coordination. So if the need and also the need to delegate authority, delegate the resources, delegate the funding, so that they can make decisions on a timely manner. We all know that during COVID-19, there was a huge gap that we need to fill. The need to come, needs from Western Pacific region to country offices, there was huge difficulty in the communication and the coordination of that to happen. But for me, that's need to strengthen, and that's why in my presentation there's a need of delegation of power of resources and authority to country offices so they better manage resources as they need. Thank you.
I shall now give the floor to Franz to ask the question.
Thank you. Thank you very much, Chair. And thank you, Dr. Buchanan. Minister, thank you very much for your presentation. I had a question with regard to the training of staff in the regional office to see what is your vision with regard to the needs for training, the link you want to establish with the Health Academy of the World Health Organization in Geneva, and more generally, more globally, how you envisage to progress staff from the regional office if you become the regional director. Thank you very much.
You now have the floor.
Thank you. What I alluded to in my presentation is training on policies, what is already exists. Make sure that the staff knows their rights, zero tolerance. That's what I alluded to. But your questions on training, yes, I also believe there's a need for professional and personal support in terms of training of our staff. And I know there's a link for the training within WHO Academy in Lyon. And I think that we need to encourage that. So the staff knows that there is an opportunity for them. Professional development is one of the key issues for our staff, and that is an incentive for them. For me, we need to look after and support our staff who are delivering services to member states. As I mentioned before, this is all about people. We need good people in the office to deliver better service. And good people, we need professional development and training. We will continue. I will continue to support training our regional office staff to be able to deliver better service to the member states. The other thing that I will look whether we will continue with this training program of WHO within the WHO Academy in Lyon, or whether there is another alternative for training in other areas, in other places where they can offer the training. Thank you.
I shall now give the floor to Japan to ask their question.
Thank you, Saya Pirakau, for your presentation. We would like to ask you about the relationship with donor countries in a region. While the focus of the programs funded by headquarters is mainly focusing on African countries. In this regard, it is necessary to secure enough resources to our region in order to promote health. So in this regard, we would like to know, if you are elected as regional director, how would you secure its financial resources? I thank you.
Dr. Piakala, you now have the floor.
Yeah, thank you. I think this is a very important question. we know that the finances of headquarter and the Western Pacific Regional Office is mainly from the headquarters, from assessed contribution of member states and flexible fund. But I think the important thing here is to engaging other development partners for voluntary contribution. I understand that the WHO works in partnership with UN partners, and this is very important that we need to continue. We cannot only rely on those WHO and UN partners like UNICEF have their interest in children, the UNFPA, maternal child health. But we also need to engage other partners like CAVI for pandemic preparedness, even World Bank, Asian Development Bank. So we can increase the voluntary contribution from those donors to assist the work of the WHO and Western Pacific Regional Office. And that's at the level of WHO. But it's also important for me not only rely on those donors, but member states within countries can engage development partners that are already in country. And it's important to define the role that they will deliver and help in health. So to avoid duplication of the health services that they will provide and deliver. And I think that's how I will look at the donors to increase their contribution to headquarters as well as the regional Western Pacific Regional Office. And like what I said, the three-level, there's need to be interaction and coordination between the three-level, headquarter, regional office, and country offices. Country offices has a role to play in getting development partners. The WHO can support member states on those and fill the gaps that those development partners is not filling with their assistance to countries. Thank you.
Yeah.
I shall now give the floor to Malaysia to ask their question.
Thank you, Mr. Chair and Your Excellency. From Malaysia, I have one question for you. What are the strengths of the region and how would, as a regional director, utilize them to further improve the health of population in this region? Thank you.
Please, can you repeat?
What are the strengths of the region and how would, as a regional director, utilize them to further improve the health of the population in this region?
Yeah, thank you, Malaysia. The strength that I can think of this region, and as I have alluded to in my presentation, we are home, regional office is home for 1.9 billion. A well-diverse region, and but what I have admired about the region is regional cohesion. I alluded to in my presentation the Framework Convention on Tobacco Control. We are the only region that are signatories to that framework convention. I will bring an example for Pacific Island countries. There's a regional cohesion that the whole 21 Pacific Islands signed on NCT roadmap. They also have Mana dashboard as an accountability framework. So the members of the region have come together and agreed on those issues to address member states in the Pacific. If only the Western Pacific region had the signatories for FCDC, none other regional organization in the WHO has ever done that. And I think this, the strength of this region, the regional cohesion, the ability for our region to come together and agree on important issues that will affect the lives of their population. And then we have to strengthen that regional cohesion within Western Pacific region. Thank you.
Thank you so much.
I shall now give the floor to Australia to ask the question.
Thank you, Minister Piakala. I wanted to ask, as Regional Director for Wipro, how would you draw on your crisis management experience to prepare for and respond to emerging public health crises in the region? Thanks.
Dr. Piakala, you now have the floor.
Yeah, thank you, Australia. And I think this is a very important question on the crisis. As we all know that climate change is a big issue here. And I think the change in the environment and the change that we're having now, it is important that we prepare ourselves for the next event, whether it's pandemic or natural disasters or climate change. I think what is important here that we use technology. I think that it's important that advancing health information system and digitalization is very critical at this time. COVID-19 taught us a lesson and opened our eyes to see the importance of technology. So if we address digitalization, where people have quick access to health promotion, remote areas, you can also have telemedicine, you can use those technology to get you better prepared for any crisis or any event. So having said that, the change in the environment that will allow accelerate response and access to health services. You access to health information on a timely manner. You to health promotion through as well. And especially the remote and isolated area, they can easily have access to the healthcare. So having this digital health that will bridge the gap between patient and healthcare providers. You can telemedicine for those in very isolated remote area where health services is very difficult. And I think that is very important that we address in terms of preparedness. Our health system needs strengthening, and COVID taught us the importance of community participation in the sectoral coordination to be able to get us better prepared for the next event. Thank you.
The total time for this interview has been exotic. Just a little half a minute. So thank you very much for Dr. Pio Kala for being with us today. You may now leave the conference hall. This concludes our morning session. So we will reconvene again this afternoon at 1:10 Philippine time, 13 past 10 Philippine time. After lunch, we have a short break for lunch. Just wait for the both candidate to come.
Quelques instants.
Thank you, Dr. Susan,
Merci,
for joining this interview today.
Dr. Mercado.
Please proceed with your oral presentation of up to.
Voyez-vous?
Again, thank you, Dr. Susan Mercado, for joining this interview today. Please proceed with your oral presentation of up to 20 minutes. You may do this standing at the podium or seated at the table. You now have the floor.
Thank you, Mr. Chair. And good afternoon, good morning, good evening to our members of the member states who are here with us today, for your time and your patience listening to all of us, our distinguished officials of the World Health Organization, and ladies and gentlemen. We have been through the worst pandemic in recent history, and we have survived. But we shouldn't forget that there are close to 6.9 million families that have lost someone. And I personally have lost a couple of friends in the pandemic. So while we have survived, we do know that there is lingering pain and suffering from, I would say, sudden deaths in families and in circles and communities. One of the lessons of the pandemic is that no country could have made it without the help of others. And countries need to help each other. However, I think our region has done relatively well compared to the other regions. But based on the Bureau's text of the WHO Convention Agreement or other international instrument or pandemic prevention, preparedness, and response, or WHOCA+, very interestingly, the preamble starts with, in recognition of the catastrophic failure of the international community in showing solidarity and equity in response to the coronavirus pandemic. ... And it goes on to talk about why we are negotiating for a treaty or some kind of an international agreement on pandemic response. So solidarity and equity are really key issues, whether we are thinking of COVID or the other major global determinants of health that are on the horizon. So we have learned from COVID-19 too that life as it is can change overnight. And that's what's happened for many people, especially for those who lost loved ones. But there's also climate change. No, open the television set and you see the same images and you're wondering which country it's happening in. So catastrophic events from flooding, from fires, or even earthquakes, these things are happening at an alarmingly increasing intensity. And again, these things can change our health gains overnight. And then there is conflict. So on a personal note, I'm a student of World War II. I love to watch World War II movies and understand what happened in that era. And I'm really personally quite concerned about prolonged conflict in Europe, the Middle East, and the political tensions of this region. So conflict is another of those, what should I say, global determinants that can change or sweep away all our health gains overnight. Now, what is the role of WHO in this highly complex world with COVID-19 pandemics, climate change, and conflict? What's the role of WHO? So one of the DGs that I have always followed is Halfdan Mahler, and I'm smiling because I can think of his face while I'm going to quote him, who established the slogan, well, it's not a slogan, the goal of health for all in the 1970s. And he said at the 61st World Health Assembly in 2008, the role of WHO is to act as the directing and coordinating authority on international health work. Then he says, please note that the Constitution says the and not a directing and coordinating authority. So it's very clear we have a global mandate. And I think, listening to the earlier discussions, of course, there are questions about what's the regional mandate when you have a global mandate. So that's something that I think we will continue to discuss. But I worked here in this regional office for more than 12 years. I have a total of 15 years of senior management work in the World Health Organization, 12 of which were here in this office. And I would say the regional office makes sure that the global mandate is implemented in a timely manner, but that the regional office brings context and cultural appropriateness to norms and standards that may seem sterile from Geneva. When it comes down to us, there needs to be some kind of translation that is dependent and contingent on the relationships we build with our member states. As the technical agency of the United Nations, we are in charge of SDG number 3. And in my long years in WHO, I did work on the MDGs and I also worked on the SDGs. And I won't go into detail because every country has its own set of priorities for the SDGs, especially for SDG 3. But I just learned studying or preparing for this meeting that WIPRO is monitoring 88 indicators of the SDGs. It's a huge number of things we are monitoring. And I stopped and thought about it and said, okay, if I'm asked, how are you going to manage monitoring 88 indicators? So I have been a manager of large and small organizations. I started out as a community physician in a slum in Manila. I was working on a maternal and child health project on UNICEF for 5 years, and I was serving about 30,000 people, and I was the only doctor in the community. I've also worked in large organizations, so I was under Secretary of Health and Chief of Staff. Our central office organization 72 local governments and 14 regional hospitals. And I had to do sort of macro level tasks. And so when I think about the 88 indicators that we're monitoring, this is what I do every time I manage something. I think about 3 buckets, okay? One is for the unfinished business. The second one is for the fires that you have to put out because you have a crisis almost every day. And the third are the strategic concerns, because you can see already from evidence and trends that something bad could happen and could affect a lot of people. So I would like to think about that in relation to the regional office, that we do have the first bucket, all right? The lingering issues of maternal mortality, this has gone down considerably, but we still have a couple of outlier countries where maternal mortality is still greater than 70. Same is true for infant mortality and child mortality rates. Water and sanitation, we've been talking about that for 20 or 30 years. And we continue to have reversals because of the way development has commenced in certain places. But the fact is, water and sanitation is still an issue. And despite all of our gains in childhood immunization, measles is on the rise. Hepatitis, that mandate has not been completely fulfilled. And there's the persistent malaria, tuberculosis, and HIV. So that's bucket number one, the lingering problems. Bucket number two will be the fires that you have to put out in the present. And at the top of my list there, as the first NCD director for WHO in the Western Pacific, are the non-communicable diseases, which account for 80% of deaths and causing immense suffering and immense expenditure in countries because of our inability to keep up with the curve. Mental health is also on my list for the crisis management part. I think if we take a look at what's happening to young people today, we take a look at post-traumatic stress disorders from the pandemic and how burnt out our health workers are. Those are all mental health issues. That's part of a crisis that we are now seeing. Of course, there are catastrophic environmental events and the concurrent displacement that occurs when you have a flood or a fire. The lack of nurses, midwives, and community health workers, I think that is at crisis level. I visited many places where you don't even have a nurse or a midwife at primary care. Hunger and food insecurity worsened after the pandemic, and with the war in Europe, prices of food have skyrocketed. Prices of drugs and medicines have also gone up. There is poor air quality in many parts, many cities of this region. And of course, there's antimicrobial resistance. Those are all in the middle bucket where there is urgent attention needed. Now, there is another bucket, which is the strategic concerns for health that we cannot escape from either, because evidence is showing us how this is becoming increasingly worse. So there I would put slow onset events of climate, like ocean acidification or sea level rise or loss of biodiversity. You don't see these things, but they're creeping up slowly and destroying our environment, and therefore will have a huge impact on health. Food scarcity, water scarcity, conflict and war, migration across borders, not migration inside countries, but migration from one place to another, from one country to another. The growth of rural poverty, the feminization and urbanization of aging, more antimicrobial resistance, and of course, the persistent pandemic of misinformation that makes it very difficult for us to implement what we need to do. Now, this all sounds complex and daunting. And you know what? It is. It's complex and it's daunting. And the job of the regional director, I do not have any false notion about how hard it is. It's a very difficult job. I've worked under 3 regional directors, and I know the toll it takes on their health, on their families, and on their life. So this is a daunting job, but it is with its own consolations. And we need to continue the good work that this regional office has done. I was just looking outside at the publications and saying, oh my goodness, so many things, so many great things have been done by the regional office. So we need to continue this, and we need to aim higher, and we need to move faster, and we need to be more relevant to the member states. Now, there were a lot of questions about the staff. And I guess this will come out in Q&A a little bit more, but let me just say that in my 15 years in the World Health Organization, what I know is that WHO staff are resilient. They have the ability to bounce back. Now, some are more resilient than others. And this is not to say that we should not have direct interventions to build resiliency within the staff of WHO, but that there is a lot of hope, I think, to try to regain or recover whatever confidence we have lost in ourselves. It is incumbent upon us to make sure that our staff are in a healthy workplace so that we can deliver on the triple billion goals of the entire organization. And this requires an environment, culture, and values that are fully consistent with the Code of the United Nations, because we are, in fact, the technical agency for health of the UN. Now, every time I start a new job, I always ask myself, what are you going to be remembered for what you did? And it's a very difficult question for a regional director, but I tried to narrow down what I thought might be my deliverables after 5 years if I'm elected. The first would be to make sure that 100% of our member states have developed policies, plans, and have investments and capacity that is fully aligned to the proposed Pandemic Prevention, Preparedness, and Response Treaty, or WHO CA+. Now, I worked with the Red Cross movement for about 5 years and was COVID-19 strategy advisor for the Asia Pacific region of the Red Cross. And I do have a sense of the difficulties of logistics and procurement in times of emergencies. And I think this is an area of concern for many governments, for many health agencies. Nevertheless, we should not let the opportunity pass for using the lessons of COVID-19 to build stronger public health systems. Second, we have to do a better job at supporting nurses, midwives, and community health workers in every health center. I was here in the regional office when we had a regional advisor for nursing, and I do believe that we have to bring back that kind of person or that kind of resource that can help us work with the sector. This is a global crisis. All over the world, we are losing our nurses, and nobody wants to study nursing because of COVID-19. So whether these are rich countries, small countries, big countries, not so rich countries, human resources for health is now a crisis, I would say. And I have visited places where wards are closed because there are no nurses or health workers. Now, I work as the co-chair of the National Panel of Technical Experts of the Philippine Climate Change Commission and have done a deep dive into climate change and health. And I think we have to do something about climate change in the health sector. But we have to start with a baby step. And I think that baby step is making sure that our health facilities are climate resilient. And climate resilient can mean many things. It can be retrofitting. It can be elevating our health centers. It could be using solar energy. But one I would like to focus on is making sure that all primary care centers in the region have water. I just saw a report recently that 40% of primary care centers in the world do not have running water 24/7. So I don't know how we deliver on all these beautiful promises on primary healthcare and universal health coverage if the simple need for water is not met in our health facilities. And there have been situations where large hospitals have had shortages in water. And it's a logistic nightmare, but it is happening in some parts of this region. The fourth, which is something very close to my heart, is regulation on vaping or the use of electronic cigarettes. And I'm going to say that in the same breath that I will say we have to continue to sustain our work on tobacco control. We have to do something about harmful use of alcohol and illicit drugs. And these are all also in the SDGs. This epidemic of vaping or e-cigarette use is going to hurt or is hurting so much of our youth. And some countries have statistics that go like 30% of children aged 9 to 13 are already vaping. And the industry says that, oh, it's a tool for cessation. No, it's not a tool for cessation if you're giving it to children. So I think if we want to protect the health of youth, we have to do something about these harmful products. The third and the last point of my five deliverables would be community action for food and nutrition security. I was in Hawaii for 3 years. I just came back last month, and I was the director for food systems and resiliency at the Hawaii Public Health Institute. And I was working in a context where 90% of the food is imported. People are sometimes shocked to hear that, but that's the situation in the Pacific as well. There is no country on this planet that is 100% self-sufficient in food. Food is imported. But if most of your food is imported, what happens when you have a disruption in the supply chain? And in the case of Hawaii, what we were looking at was the islands only have 5 to 7 days worth of food, but the ships stopped coming into Honolulu. So I was doing a project on setting up 1,000 community gardens. I was just starting to do work on it, but I do want to see food security addressed at the level of primary care. We've seen how hospitals, primary care facilities can work on gardens, forests, vegetable production, and actually use that to combat our fight with NCDs. Just a few more notes.
Could you please conclude?
Conclude now? Okay.
Time's up.
Yes. So what I bring to the table is ethical leadership, expertise in certain fields, and 15 years of experience at senior management in the World Health Organization. And I will look forward to upholding multilateralism and seeing to it that all countries have a fair chance in the World Health Organization by following the rules of the United Nations. Thank you very much.
Thank you, Dr. Mercado. We will now continue the interview with question and answer. I will now put the first token with the name of a regional committee member which expressed their wish to ask a question to Dr. Mercado. I shall now give the floor to Malaysia to ask their question.
Thank you, Mr. Chair, and thank you very much for your excellent presentation just now. And yeah, for Malaysia, I have one question for you. Why do you think you deserve to be elected as the regional director of WIPRO? Thank you.
Okay, I thought there was something else coming out of that. I'm having an echo and I can hear myself through this. You can't do anything about that. Okay, so thank you very much from our colleague from Malaysia. I've got the requisite experience, which is more than 15 years in the World Health Organization. I understand this region very, very well, and I know this region very well. I am committed and determined to make this the swan song of my career. I have worked with other international agencies aside from the World Health Organization. And I think it's time to have a woman regional director after Dr. Jacob. I think men and women can do things equally well. But in a world where there is so much complexity and people are hurting after the pandemic, and there is immense burnout in the health sector, I think women bring in the lens of family and relationships in all their work, and therefore find it easier to create a nurturing and caring environment. So, based on those, my experience, my leadership that speaks for itself in my track record, and my own expertise in certain public health fields, plus being a woman that is quite sensitive to the needs of this region, I think I deserve to be the next regional director.
Thank you. Thank you so much.
I shall now give the floor to China to ask their question.
谢谢主席，谢谢 Macedo 博士的。
Thank you, Mr. Chair, and thank you, Dr. Macedo, for your very detailed sharing. At present, an important topic in global public health is to improve the response to new emerging infectious diseases. Governments across the world are improving their discussion among the INB and the IHR Amendment Committee. Efforts are undergoing on those two platforms. We know that the WIPRO region boasts great emergency response capacity and a resilient public health system. The previous two RDs have made great contribution on those fronts and shown brilliant leadership. Our question is, built on the past work of our region, how would you plan to further promote the building of a health emergency response, especially APSED 3 document implementation? Thank you.
Thank you very much.
You now have the floor.
Thank you so much. Sorry, Chair. I think the regional office could play a bigger role as a coordinator for procurement of supplies and materials needed for pandemics. So that includes vaccines, diagnostics, and therapeutics. I think the economies of scale don't allow smaller countries to purchase internationally what they need. And therefore, the regional office could play a role in making sure that there's greater equity in access of the materials that are needed for pandemic response. Now, this is not the first time this has been done. I mean, I remember in the time of J.W. Lee when he was Director General, 3x5 was launched and WHO actually negotiated for the price of antiretroviral drugs to go down. So I think there is a new role that we can explore and look at to make sure that we have greater solidarity and equity, and that would be in regional logistics and procurement.
I shall now give the floor to France to ask their question.
Merci, Monsieur le Président.
Thank you, Chair. Thank you, Dr. Mercado, for your presentation. The question of France has to do with financing and resilience. Every technical and financial partner tends to push countries to develop resiliency plans in the face of various different pandemics. Do you think that the regional bureau can play a role in the mobilization of national resources and the coordination of various initiatives that will need to be taken in that field? Thank you.
Very
Mercado,
much.
you
I think yes,
now have the
definitely.
floor.
I think the Bureau for the INB could play a very big role in supporting that kind of work. I just wanted to say that when we are thinking about pandemic preparedness, prevention preparedness, and response, it is of critical importance for countries to have their own investment plan and their own honest assessment of what they can do and what they can't do. And when we think about financing, three things come to mind. First of all, we can think about increasing the level of resources that are available to countries that have low resources. Secondly, you could look at having more sources of funds and not just one or two donors. And the third would be, how do you improve efficiency within existing levels of expenditure? So that means that how do you avoid wastage? How do you optimize whatever you have? And how do you become overall more efficient in your pandemic preparedness? So I think the financing argument, the financing part of this really will depend on our ability to see what the opportunities are for different countries. And different countries will have different opportunities. Some countries have something like sister countries that help them, right? So you could think of additional funds coming in. But for those who don't have that, then I think the Bureau could think about something like what we have for the Green Fund, where you have some kind of a global fund that countries can apply to and can justify why they should have more money for pandemic preparedness.
I shall now give the floor to United States of America to ask that question.
Thank you, and thank you, Dr. Mercado. If elected, how would you build trust with the Wipro staff and promote an ethical and equitable culture within the office? And what management practices would you use to ensure that there's an enhanced accountability at Wipro?
Let me start by saying that as the technical agency of the United Nations, there are protocols, rules, and ways of doing things. And the first thing to do is to make sure that we are actually following the codes of the United Nations. That's the first. The second thing is, when we talk about a healthy workplace, there are three components to that. There's the environment, because we know that the environment affects behavior. There is culture, and what are the sort of unwritten or unspoken norms within a group, and then values. So I would say, to be very concrete, I'd have lunch in the cafeteria with anybody at any time. I think being accessible is so important. I would encourage a lot of what we call extracurricular activities, but now just looking at a document outside that said social prescriptions, I think we need social prescriptions for our staff as well. When they're feeling burned out, they should be able to do community work, to garden, to sing, to dance, whatever it is that they like to do that helps them reinvigorate themselves. Okay. The third thing is, I'm a big fan of international potlucks. That used to be something we did here a lot. Like at any excuse, somebody's birthday, we all bring food made from the house. And that creates interaction that is not related to the work, but it's just related to the fact that you're human beings who are interacting together. So I think an increased level of interaction that is non-work related can help build trust. Transparency and accountability by following the UN rules and regulations will build trust. And I think people will trust each other if we can create an environment where it is safe to speak, to share your ideas, even where there is disagreement.
I shall now give the floor to Solomon Islands to ask their question.
Thank you very much, Dr. Mercado, for your presentation. Now, using your past or current experiences, provide an example of a significant resource mobilization that you have secured as additional financing that could be adopted as strategies to boost the WIPRO regular and core budget.
Thank you for that question. I was program coordinator for the Tobacco Free Initiative for I think 5 or 6 years. And from a very small program, it became a multi-million program. But that was not, I can't say that was purely because of my efforts to mobilize resources, but the fact that new donors came out, like the Bloomberg Initiative, and other donors. And the point was, we were ready to absorb new resources. So I think I won't claim credit for how that program grew, but I would say that resource mobilization and financing is a combination of skill in defending your budget, but also in understanding what donors want and meeting their expectations.
Thank you.
I shall now give the floor to New Zealand to ask their question.
Good evening, Dr. Mercado. Thank you so much for your presentation. In the context of the reforms underway through headquarters to strengthen WHO organizational governance, what would your organizational reform priorities be for effective governance at the regional and country office level if you were elected? Thank you.
Thank you very much. The new reforms that actually delegate authority to WHO representatives and technical directors, I think for me is a step in the right direction. I believe that the decision makers who are closest to implementation have to have authority over the resources that are available to them and not have someone in Manila deciding on how money is spent somewhere out there in the Pacific or in Asia. So I do agree. I think this is a step in the right direction. This does mean, however, that we have to build capacity for proper accountability for funding at the level of the country offices. And I would say, I think constant communication with the country offices would be key. If I was elected as regional director, I would actually have bi-monthly meetings with the WHO representatives virtually. The other thing I do is I won't visit a country and deliver a speech. I'd stay in a place for 2 weeks or so and have a team that's working with the Ministry of Health on a number of issues. So I think there's a way for us to be more effective given the delegation of authority to the countries. But it also means that we have to step up and make sure that our country offices are prepared to take this on. I think the region has to think about what do you do about cross-border problems that are not within each country. So that's a key role for the region because there are so many, I can think of so many issues where, you have multiple countries that are affected by a certain problem, like the smog that hits Singapore, Malaysia, Brunei coming from Indonesia. There are certain things that are not confined to country office. So the regional office has to be prepared to do that. If I think also about cross-country advertising for harmful products like e-cigarettes or tobacco, that's not solved by one country because the radio stations or the television stations are in certain places. So I think we have to take a look at how we do better coordination with countries. more frequent communication with the countries and less, I would say more problem solving on the ground with the member states.
Thank you, Dr. Mercado.
Thank you.
I shall now give the floor to Vietnam to ask the question.
Thank you very much, Mr. Chair. Thank you, Dr. Susan Mercado, for your presentation. My question is that what strategy and solution do you have in mind to align the country, regional, and global agenda on health effectively? Thank you.
I'm sorry, can you kindly repeat the question? There was a part of it that I didn't quite pick up. Sorry about that.
Okay, no problem. I can repeat. What strategy and solution do you have in mind to align the country, regional, and global agenda on health effectively? That's all. Thank you.
Okay, so the question is on alignment between headquarters, global, regional, and country. Did I understand that correctly?
What is your strategy and solution do you have already in mind to align country and also regional and global agenda on health?
Align. Okay, thank you very much. So I think all alignment, and let me go back on my experiences as Undersecretary of Health in the Philippines, which has 7,600 islands, and I don't know how many local governments now, more than 2,000. But really, when we look at alignment between country, regional office, and headquarters, the key is to do participatory budget planning. I think the problems occur when money is available at the global level and the region is told you have to spend it this way, and the region tells the country you have to do this. I think we have always, this is like a broken record ever since I entered WHO, we always want to start with the country cooperation strategy, with the plans of the country, what the ministers want to do, and then move upward. Okay, now, that's an ideal situation, but it doesn't mean we cannot improve. So as I said earlier, I come from the Tobacco Control Program, which I think was one of the most aligned programs of WHO since the get-go, since it started. And that's because we maintain a very close network of colleagues, country, regional, and global. We have regular meetings. When there are resources available, we talk about it openly. We decide in a participatory way how much money is going where, and we know what the schedule is for the biennium, for the 2 years. So I would say this requires managerial and leadership skills on all levels, and our ability to communicate more frequently, both with the country and with headquarters. So alignment for me is a function of planning resources together and implementing at the level where we're supposed to implement, but agreeing on what our global objectives are.
I shall now give the floor to Australia to ask their question.
Thank you, Chair, and good afternoon, Dr. Mercado. The question from Australia is, as the regional director, how will you draw on your experience to effectively work with a variety of different governments and senior political leaders to achieve WIPRO's strategic outcomes? Thank you.
There's a tenet that I follow, which is strategy plus relationships is equivalent to results. So I think it's one thing to develop strategies together and to agree on those. But it's quite another thing to maintain very good, harmonious relationships. As the technical agency of the United Nations, and as Dag Hammarskjöld once said, the keeper of the nation's secrets, the UN is committed to finding ways of having things work together for peace. I know that sounds a little bit trite, but it is of critical importance that we build true, open relationships with each other, with the member states, and look at agenda setting together. So one of the things that I thought might be useful if I get elected is to really reconsider how we organize regional committee meetings. Like, do we have to do that every year? Should we do it every 2 years? Should the agenda for the regional committee be developed on the sidelines of the World Health Assembly, for example, a year before? There are a lot of things that can be done to further engage our member states in the work of WHO. And I think from my experience, building good relationships has a high premium in this region. I'm Asian, I'm Filipino, but I lived in Hawaii for a bit. I've worked in the Pacific a little bit. And I do know that at the end of the day, this is about people knowing each other more and working as a network and a team.
I shall now give the floor to Japan to ask their question.
Thank you, Chair, and thank you for Dr. Mercado for your presentation. In the UPRO region, one of the major challenges is how we can mitigate the health impact of climate change. We believe that climate change needs to be addressed by the region as a whole, and we would like to know what measures you believe would be appropriate to take if you are elected as an regional director. I thank you.
Thank you very much. Okay, climate change mitigation is a function of multiple sectors. So when we talk about reducing greenhouse gas emissions and keeping surface temperature to less than 1.5 degrees by 2030 and all of that, that requires many different sectors working together: transport, energy, housing, the environmental sector. And so we have to be at the table as the health sector, talking about what the health sector can do in mitigation. Now, there are some countries and some organizations are really pushing for green hospitals. And I think that's a great idea for countries that can afford it. But for many of our countries here in the Western Pacific, they don't even have enough hospitals. So it's like, let's not make it more difficult to have health facilities by adding on too many regulations or requirements, particularly in low resource areas. So I think mitigation is something that we have to discuss further, because that's not a core function of the World Health Organization. I think it is in adaptation where we have a big role to play, not just in terms of, I mentioned climate resilient health facilities, but also climate resilient communities. You know, the Philippines has sea level rise, which is 4 times that of the global. And as I mentioned, I work as the co-chair of the National Panel of Technical Experts on Climate Change here in the Philippines. And you know, the big problem is about 75% of our people live on coastal areas. And the coastal area communities actually need to be moved closer inland. But how do you do that? How do you How do you move entire communities? So I've also seen places, not only here, but in other places where some areas are already underwater if it just rains a little bit. So we have to prepare, the health sector has to be prepared to address the health impacts of climate change. I think in the area of climate change mitigation, we should be at the table and see how in the countries where we need to reduce greenhouse gases, we are able to do that for our hospitals. Thank you.
I shall now give the floor to Republic of Korea to ask their question.
Thank you, Chair, and thank you, Dr. Mercado, for sharing your vision. Compared to other regions, the Western Pacific region has diverse cultural backgrounds and levels of socio-economic development among its member states. Although some parts were alluded by other member states, but to make sure, please describe how you would facilitate collaboration among the diverse member states, including resource allocation and communication, if you were to become a regional director. Thank you.
Okay. Diversity is not really a problem. I think we should look at diversity as an asset that we have as a region. And in fact, societies where there is great diversity and great acceptance of our differences are societies that succeed. You know, they succeed, they don't become extinct. So diversity, I think, is an asset. I think what we need to do is to build multiple bridges across countries where we can learn to understand each other and trust each other. One of these, for example, is the language barrier of this region. So for the longest time, you know, Chinese is an official UN language, but we do not routinely use Chinese translation in technical meetings of the World Health Organization. Now, I can only speculate on why, but I think we have to overcome language barriers. We have to overcome barriers in terms of representation of smaller states and smaller countries in the Pacific. For example, I think one of our colleagues mentioned that in the regional office, because the understanding of the island context is fundamental to our ability to develop appropriate responses. And if we have technical experts who do not understand the culture, the lifestyle, the values of communities in islands, then we cannot embrace the diversity, right? I think language, multiple bridges, communication, of course, is always bandied around as a good way to bridge our diversity and reach out to others. But I caution a little on that because in using information technology, because we do know that there are many places where Wi-Fi is not available. And so then you use virtual meetings and use technology to bridge certain gaps. But then that can also create new gaps if countries don't have a cabling system. And so therefore, we have to think about those multiple, I would say, millions of bridges that we need to build so that we can understand each other more. And that takes a lot of work. It does take a lot of work. But I think this region has a spirit of unity. And I would say that the regional office can be a unifying force for the entire region. Thank you.
Thank you, Dr. Mercado.
We have now exhausted all of the questions for Dr. Mercado, but there is still time remaining before the 60 minutes allotted for this interview have elapsed. In accordance with what has been previously agreed, I will now open the floor for any regional committee members which have not yet asked a question and wish to do so now. In this case, please raise your hand in Zoom. I see none. As I see no more hands raised, and there is still time available, the candidate is invited to make any additional statements. You wish us until the end of the 60 minutes. Dr. Mercado, you have the floor.
Thank you very much, Chair. So first of all, I'd just like to thank the Chair, thank everyone for this opportunity. Thank you to the member states for the, what should I say, the very intense questions. I just wanted to say that we live in a world where the geopolitical issues of the day are quite strong. And I just wanted to share with you that health goes beyond our geopolitical boundaries. I think there's no time in recent history that the United Nations has become more important in maintaining world peace, and health is a requisite for peace. And so I think we can rise above all the things that divide us. As the saying goes, what unites us is greater than what divides us. And I think we all want health, regardless of what our geopolitical affiliations are, regardless of how big or how small our countries are. I think we all want health, and we all want everyone to be healthy. That is a very noble purpose. And I come to this election holding that in my heart as an inspiration to live by, that health is higher than all our geopolitical differences. Thank you so much.
Thank you very much, Dr. Mercado, for being with us today, because time still remains, but no more question and additional statement already made. So you may now leave the conference hall. And please allow us a moment to invite the next candidate into the room. We shall now proceed with Dr. Tran Thi Chiang Huong. Thank you, Dr. Tran, for joining this interview today. Please proceed with your oral presentation of up to 20 minutes. You may do this standing at the podium or seated at the table. You now have the floor.
Thank you very much, Honorable Minister Bun Phang, Chair of the Live Forum, Acting Regional Director, Dr. Suzana Jacob, Honorable Minister, distinguished participants from member states of the Western Pacific region, and participants who joined online. I hope that I'm last but not least. First of all, I would like to express my sincere thanks to Honorable Minister Bun Phang and the WHO Secretariat and all the member states for this great opportunity for me to present myself as the candidate for the position of Regional Director of the WHO for the Western Pacific region, and to allow me to present my vision and my priorities. I am Dr. Hương Thị Giáng Trân. I come from Vietnam, a country with long history and rich cultural tradition located in Southeast Asia. Vietnam has a population of more than 100 million people, comprising of 54 ethnic minorities. It is a rapid developing country with a high economic development growth over the past few decades, making it the emerging economy in the region. Vietnam is also known for its people-centered policy, especially putting people at the center of our socio-economic development plans. Vietnam Human Development Index is 0.7.3 as compared with other countries at the same level of economic development. We have a high level of Human Development Index. Vietnam is also known for a very strong and well-structured healthcare system, especially primary healthcare, with more than 11,000 community health centers covering the whole country. We also have achieved a remarkable result in health indicator, especially for life expectancy at birth, as well as maternal mortality and childhood mortality. Vietnam is also known for its track record on combating with communicable diseases and outbreaks. We were the first country to combat successfully the SARS outbreak in 2003. And subsequently, we also successful in combating other outbreaks. We are also on track on malaria elimination and maintain the high level of immunization coverage. Vietnam is also committed to global health agenda, and we are ready to share our best practice and our lesson to other countries in the region. With more than 3 decades working at different roles and functions, at national, international, and regional level, I serve in different roles, from the clinician to public health expert, the scholar, a manager, and a leader. With 25 years working at the national level, I have deeply engaged in policy development and implementation at national and subnational level, as well as participated in lawmaking processes. I would like to share with you that I have been engaged in making the health insurance laws, the law infectious disease and prevention and control, and the law on tobacco control. I also engaged in developing the policy and strategy in strengthening primary health care, especially focusing on increasing the quality of care and capacity building for healthcare workers at grassroots level. Regarding my international experience, I have served in different roles in regional fora, including chair of ASEAN Senior Official Meeting on Health Development, together with ASEAN member states to develop the ASEAN Health Sector Strategy and ASEAN Post-2015 Health Development Agenda. I have also chaired the APEC Health Working Groups on health collaboration among APEC economies. I have a privilege to serve as an alternate member of WHO Executive Board from 2016 to 2019, representing WHO Western Pacific region countries as the highest governing body of the World Health Organization to participate in shaping and deciding on global health agenda and global health priorities. From July 2019, I served in WHO as the director of the Division of Programs for Disease Control, which, responsible for communicable diseases, prevention and control, NCD management, and mental health. During my 4 years working experience and serving in WHO in this position, I led my team to develop the 6 regional frameworks upon the request of the member state on many important technical areas. I would like to share with you here. The first one is the regional framework on vaccine preventable diseases and immunization. We are the first region who translated the Global Immunization Agenda 2030 into regional action plan, and it served very well during COVID-19 pandemic. We also developed the regional framework on ending tuberculosis with the innovative approach of not addressing the disease as a silo approach, but also the comprehensive and system approach to end TB in our region. I also work together with my colleagues to develop NCD prevention and control framework with the innovative way of shifting from the sick system to the health system to address NCD issue. And of course, we also work closely with member states to develop the regional framework on the future of mental health, with the also very future-looking approach to address the mental health issues in our region. We also developed a framework on cervical cancer prevention and control. And last but not the least is the framework on reaching the unreached, which is very close to my heart and which is also linked to my vision of protecting the vulnerable population. During the initial stage of the COVID-19 pandemic, I was assigned to be the acting director of the Division of Health Emergency and Security. During this most critical time of the pandemic, I led the team to develop the regional action plan on COVID-19 response and the incident management teams. Later on, since November 2020, I was assigned to be the chair of COVID-19 vaccine working group, responsible for coordinating COVID-19 vaccine and vaccine deployment in the Western Pacific region. It was the most difficult time, a lifetime experience for me, working in a dual role. And it was also a rewarding opportunity for me to serve people and to serve member states. One of my most memorable experiences is the effort to mobilize and utilize COVID-19 vaccine in the region. Our region has put the highest priority to protect the most vulnerable populations and the countries that need support the most, particularly Pacific Island countries and low middle income countries. I also experienced the profound strength of solidarity and collaboration of our region on COVID-19 vaccine dose sharing and COVID-19 donation among member states in our region. I'm very proud of the effort made by member states in the region to achieve the highest level of COVID-19 vaccination coverage, 86%, as compared with other parts of the world. A lot of lessons we learned from this. It is a strong political commitment, the wholehearted healthcare workers, and the engagement of the community to respond to COVID-19 pandemic. Those efforts on reaching out to the people in outer islands in the Pacific and the ethnic minorities in the Mekong areas was a vivid example of how we protect and we serve our people. I would like to take this opportunity to thank and pay tribute to all health workers who devoted their life to save the people during the pandemic. I also like to thank my colleagues who work closely, the two teams from two divisions, who through working with me closely during this most difficult time. Let me now briefly share with you my understanding and my perspective about the opportunity and the challenges that our region is facing. Our region is one of the most dynamic and diversified regions a home to over 1.9 billion people, making up more than a quarter of the world population. It stands out for its rich cultures, ethnicity, geography, and development diversity. Our region is also a most vulnerable region for climate change, such as the extreme weather event, sea rise level, typhoon, flood, and also the region is also at risk from natural disaster that can make the disruption in the infrastructure and the healthcare facility and compromise food and water security. Our Western Pacific region is also one of the most rapid urban growth, which also brings the profound impacts on the socio-economic inequality and migration challenges. We also observe the demand of an aging population in many countries, and we heard from other candidates when we address this issue. From the healthcare sector perspective, we observe the dual burdens of communicable and non-communicable diseases, especially the fast rising trend of non-communicable disease, which accounts for 87% of the deaths in our region. We also see that the health system in many places experience weaknesses, including fragmentation, inflexibility, and inefficiency. The regions also struggle with achieving universal health coverage. Taking into account the opportunities and the challenges that our region faces, and building on my experience at the dual perspective, working at national level, regional level, and working for WHO, my vision is to lead the Wipro workforce to work with the member state to build a healthy future together. My vision underscores the collective responsibility where everyone enjoy equal access to healthcare service, regardless of their background. Our collective strength lies in working together across the member state, all stakeholders and communities. Only by working together and putting people at the center of our work, we can put, especially also protecting the vulnerable population, we can ensure a resilient, equitable, and healthier tomorrow for all. As a person deeply engaged with the healthcare fabric in the Western Pacific region, my top 5 key priorities align with the global agendas and take into account the specific characteristics and challenges of the region. First one is the transforming the healthcare system, especially revitalizing the primary healthcare to improve the health outcome of the people and to achieve universal health coverage and SDG goal. Strengthening primary healthcare is imperative because 90% of healthcare services can be delivered at this level, and we can ensure the accessibility, affordability, accessibility, and quality of care. I wish to reiterate the statement by WHO Regional Director, Dr. Tedros. There is simple, no better investment in health than in primary healthcare. By strengthening primary healthcare, we can provide services to the unreached and the most vulnerable population to ensure the equitable access to healthcare and leave no one behind. To do more in this area, I propose implementing innovative approach, including the local solution, including the applying digital health and other service innovation to access to the primary healthcare services, especially for the people at the remote and underserved areas. Additionally, I propose investment in human resource for health. The COVID-19 shows us that how much important the human resource for health, and especially we would like to focus on strengthening the primary healthcare providers to ensure that they can be equipped with skill and knowledge necessary to provide integrated quality primary healthcare and address the rising issues of social, economic, and communicable disease disparity and the communicable disease, NCD, and aging. My second priority is about enhancing the emergency preparedness and response. The COVID-19 pandemic taught us many good lessons. We need to enhance our capacity to proactively prepare for and respond to the future pandemic by fortifying our surveillance and early warning system and response mechanism. By being proactive in our preparation, we can respond quickly and effectively to health emergency, minimizing the impact on population and building a resilient health system. We can address other health emergency as the impact of climate change and other emergency. The Asia-Pacific Health Security Framework have served, or we call the previous name is UPSET, has served as the strategic framework to advance the implementation of international health regulation in the Western Pacific, in Asia-Pacific region. And over the past 15 years, by implementing this UPSET framework, our member state was able to cope better with the COVID-19, and our region is also achieved the lowest level of mortality and morbidity due to COVID. We will continue our effort and by implementing this framework, and I particularly advocate for ensuring the availability and the equitable access to medical products and vaccines, especially focusing on local production and technology transfer at the regional level. My third priority is the promoting healthier population by elevating health and well-being of the population to a primary societal role and policy making across all the sectors. The COVID-19 pandemic taught us how important health is. And when health is at risk, everyone is at risk. We have a saying that prevention is better than cure. By promoting overall health and well-being of people and shifting from the sick system to the health system and keeping people at the center of our work and keeping people also at the safer and the healthier side, we can maximize their health outcome and also can achieve universal health coverage. To promote this strategic shift, the empowerment of community and individual is paramount because we need to consider them as equal partners to ensure that they can make a healthy choice. My fourth priority is about strengthening one WHO team, which is very, very dear and close to my heart. I'm committed to this priority because people are a asset of any organization. I will lead the continued and strong efforts made by Acting Regional Director, Dr. Susanna Jacob, to promote a motivating and supporting environment to make WHO Western Pacific truly a place to nurture the efforts to serve member states better. I'm committed to ensure a safe working environment where every people feel being valued, respected, and motivated. I'm committed to continue efforts on simplification process and delegation of authority to strengthen the efficiency of the organization. I'm committed to advocate for one team approach when staff at 3 levels of the organization work as a one team in the most coordinated manner to serve people and member states. Last but not least, it is the intensifying partnership. We heard a lot about partnership over the other section, especially we focus on the collaboration. And partnership is the critical to make sure that we are working as one on the health objective. At the same time, I think it's really important for WHO to facilitate the knowledge sharing and experience learn from each other so that we can have the peer learning from each other. And our region is known for many good practices and we can share among each other. I believe that our collective effort with the strong support of the member states to address the health challenge, will be able to address the health challenge in the region. If elected as the regional director, I'm committed to lead the WIPRO workforce and the country office to work closely with member states to translate the vision and the priority into action. Let's work together on the vision to build a healthier future tomorrow.
and leaving no one behind. Thank you very much for your attention.
Thank you, Dr. Chan. We will now continue the interview with question and answer. I will now put the first token with the name of a regional committee member, which express their wish to ask a question to Dr. Chan. I shall now give the floor to New Zealand to ask their question.
Thank you, Dr. Tran, for your presentation. The Western Pacific region is unique and diverse, with countries of varying degrees of development and population sizes. How will you ensure that WHO delivers for all member states in our region, including the Pacific? Thank you.
Thank you very much for the question. It's a very very important question, and it's also very close to my heart. As I mentioned earlier, our region is very diversified. And we have in terms of population, we have the biggest country and we have a very small country with the different challenges. And the WHO should be in the role to consolidate on the inputs and the challenge and also the best practice from different countries and also to listen to their need to make sure that we can respond to the need of member states, taking into account their specific context and specific challenges. For example, for Pacific Island countries, we know that they are most vulnerable for climate change, and they are also the top countries in terms of NCD burden. So we will have this special approach to support the countries in Pacific. I take an example. When we developed the regional framework on NCD, prevention and control, and the mental health framework, or even the cervical cancer framework, we always have a very thorough consultation with the member state from Pacific. We listened to them, we heard from them, and we consolidate all the input to make a very comprehensive regional framework so that everyone can follow and can implement. So it is the approach that WHO should be in the position to support. In addition, we should also work with other countries to facilitate the support among our member states. I go back to the cervical cancer. When we developed our framework, we think that we have a many good lessons and very strong resource, country who can support Pacific. And then we take the approach of the setting up the sub-regional mechanism to support Pacific Island countries on cervical cancer. It is a concrete example to share with you how can we address the need of the different countries and in different contexts. Thank you very much for your question.
Thank you.
I shall now give the floor to France to ask their question.
Merci, Monsieur le Président. Merci, Dr. Tran.
Thank you very much, Chairman. Thank you very much, Dr. Tran. The global health architecture is undergoing changes and challenges. What role do you think WPRO could play in terms of coordinating the various stakeholders and vertical and horizontal partners such as the Global Fund and the Global Fund to Fight Pandemics? Do you believe that WHO should take the lead? If so, how? And lastly, how do you think the regional office could coordinate with the WHO's Health Academy on issues related to training? Thank you.
Dr. Chan, you now have the floor.
Thank you very much for the question. Regarding your first question on the role of WHO in the global health architecture, WHO is a specialized UN agency that is a global health leader. And we work in harmoniously and in a collaboratively way with other partners, including Global Fund, to support member states on global health issues. We will not be taking the lead. We will work in collaboration with different partners, especially for Global Fund, the leading agency on combating malaria, tuberculosis, and HIV/AIDS. I work in the country level as the vice chair of coordinating country coordinating mechanism for Global Fund. And I saw that at the country level, we have a very good collaboration between WHO and Global Fund in the supporting member state. And we are the technical agency who can provide the support to the member state. And we work with Global Fund and try to use the fund from the organization to support the country in the most efficient and effective way. The second question is about the academy. I think it's really very good source of training for the not only for the health workforce in WHO but also for member states. I advocate for strengthening the utilization of this academy to strengthen the capacity in the Western Pacific and for the workforce in the Western Pacific region. Thank you very much.
I shall now give the floor to Republic of Korea to ask their question.
Thank you, Chair, and thank Dr. Kong for sharing your vision. The Republic of Korea would like to ask the following question. The IMB and Working Group of IHR negotiations are currently ongoing at WHO, with a deadline of the next year's World Health Assembly. As a candidate of a regional director, we would like to ask you to answer the following question about the IMB and Working Group of IHR process. Comments on the current status of play and what, if any, should be added or strengthened to ensure the health security of the West Pacific region. Thank you.
Thank you very much for the question. I may also explain a bit about the NIB and IHR. Maybe it's an abbreviation, may make member state a bit confused. So the INB is intergovernmental negotiating body to discuss on the pandemic treaty, and the IHR is the international health regulation, the working group. And these two working groups are now consolidating the input from member states to prepare for the pandemic treaty and for the amendment of international health regulation. Up to now, there are more than 3 items to be proposed to change in the international health regulation amendment. And also on the in terms of intergovernmental negotiating body. In our region, we have Japan and Singapore to be representing our region as this important body to ensure that all the comments and the inputs and the intervention from member states would be taken into account. In the upcoming UN General Assembly, they will be, I'm sure that member states know that there will be a section to discuss about pandemic treaty. And of course, in the upcoming World Health Assembly in 2024, these two, important documents will be presented. And I believe WHO is in the position to facilitate the engagement of member states in this very important bodies that makes us to be stronger to prepare for the future pandemic, because we learn a lot from COVID-19, and it is the opportunity for us to learn and to respond to those, the weaknesses or the lesson that we learned from the COVID-19 pandemic. Thank you very much.
Thank you, Dr. Huang.
I shall now give the floor to Tonga to ask their question.
Thank you, Dr. Tran Wang. If you are elected as RD, how would you address the impact of climate change on health in the region? Thank you.
Dr. Chan, you now have the floor.
Thank you very much for the question. As I also mentioned earlier, when I share with you on the challenges of this region, which is the climate change. So climate change is everyone's business. The health sector alone cannot address the issue. So we need to bring this to a whole of government, so of society approach. And I would like to respond to your question by sharing the plan and the methods that we could do. From the health sector perspective, we need to build the health and resilient health system and climate resilient health system, especially primary healthcare, as one of my key priority, because the primary healthcare can help to provide the services when they closest to the community, and especially in Pacific, in outer islands, in remote areas, primary healthcare should play a critical role. Secondly, we also need to address to build the climate, resilient healthcare facilities to make sure that when the emergency happened, these healthcare facilities stay resilient to serve the people when they most need it. The third one is the health from the health sector. We need to prepare for the changing pattern of the diseases. We see some changing pattern, especially of dengue, malaria in many settings, and we need to well prepare for that. The third thing that health sector can do is to build the case for other sector to take action, because health is most affected, and we need to build the case. We need to have an evidence base to make sure that and to present to other sector to see how can we address the issue. And from the broader approach, I believe that health sector need to work with other sectors and to make sure that we can contribute to the common agenda. For example, food security, water quality, wash, and many other areas that health sector can contribute. Thank you very much for the question.
Thank you, Madam Wang. Thank you, Chair.
I shall now give the floor to Philippines to ask their question.
Thank you, Chair, and good afternoon, everyone. Thank you also for your presentation, Dr. Tran. The question is, how would you operationalize equity in pandemic preparedness, particularly in relation to the WHO CA+? Thank you.
Thank you very much for the question. I would also want to share with you that protecting the vulnerable population is a key priority of WHO at global level and as regional level. And as indicated in one of my priority, putting the priorities on unreached population, as well as the most vulnerable and marginalized population. It is a key priority for WHO to support member states. During the pandemic time, the Western Pacific region applied the COVID-19 strategy to protect the most vulnerable population. We prioritize the healthcare workers, the people with comorbidities, and the aging population to be the first category to be vaccinated with COVID-19 vaccine when we don't have enough vaccine for the whole population. It is a vivid example how we put the population at risk and the vulnerable population as the priorities of our work. And also in the upcoming, in the draft of the regional framework on health security, we have a specific section to this to address the issue of protecting the vulnerable population. The COVID-19 pandemic teaches us that when the person at risk, no one will be safe. We only safe when everyone is safe. So I mean that in the upcoming regional frameworks that will be endorsed in the upcoming RCM, there is the specific discussion and also the strategy to protect the most vulnerable population. And on the CH plus is also indicated that protecting the vulnerable population is the key for us to respond to the pandemic. Thank you very much.
I shall now give the floor to Malaysia to ask their question.
Thank you. Thank you, Mr. Chair. And thank you, Dr. Tran, for the excellent presentation. Malaysia have one question. In your opinion, what are the biggest challenges faced by the region and how do you intend to address it? Thank you.
Could you repeat the question? Sorry, I couldn't follow. Thank you very much.
In your opinion, what are the biggest challenges faced by the region and how do you intend to address it? Thank you.
Thank you very much for your question. I believe that one of the biggest challenges that our region is facing now is the fast rising trend of NCDs. And it accounts for 87% of all deaths in our region. And if we do not address today, our healthcare system will be collapsed because we don't have enough resources to build the hospital for NCD patients. So that's why in my key priorities, I put priority number 3 on promoting a healthier population, in which we shift from the sick system to the health system, focusing on health promotion, health prevention, and keeping people on the healthy side, so that they can improve their health outcome and putting them, and we can save, the resources of the society to addressing the NCD. I also like to emphasize the importance of addressing the social determinants of health and the community and individual engagement. And in the most recent resolution in the World Health Assembly in 2023, we endorsed the resolution on health as behavioral science. And as remember, Malaysia is the leading country for this resolution. And we address the social determinants of health to ensure that people are at the healthy side and promoting health and health prevention and health promotion. So I think it is one of the key challenges among many other. Of course, climate change and aging population are also the biggest threat as well. And of course, we should not forget that the future pandemic can arrive at any time. So on these challenges has been, addressed by my key priorities that I presented to you earlier. Thank you very much.
I shall now give the floor to Australia to ask their question.
Thank you, Chair, and thank you, Dr. Tran, for your presentation. Australia's question is, as the regional director, how will you draw on your experience to effectively work with senior political leaders across a broad range of WIPRO member countries to achieve strategic objectives? Thank you.
Thank you very much for the question. As I shared with you earlier, I have a 25 years working experience at the national level, and also working in the international arena and sharing a lot of, sharing a lot of health fora. And I have been able to be working with different member states, with the countries in Asia and also in ASEAN, and also when I serve in WHO, we have opportunity to work with the member states. So being the regional director, I should be, communicating and working closely with member states to listen to their needs and also to collaborate with them to deliver our vision and our priorities, because only member states can help WHO to improve the health of the people in the region. So having the profound experience working at national, regional, and international level, especially my experience working in WHO, will equip me in the best position to be serving member states, listening to their voice, and know what is their need and their priorities, and working together as the trusted partner. It would be the most important thing. Thank you very much.
I shall now give the floor to China to ask their question.
Thank you, Jim. Thank you, Dr. Tran. Thank you, Dr. Tran. We know that West Pacific region is a very diversified region, and the members in the region are different in their society, culture, and economy, and health conditions are totally different. So if you were elected, so what's your plan to support the government in the region to strengthen the building of their own health system so as to build a more resilient system in their countries respectively? Thank you.
Thank you very much for the question. I believe each country in our region have its own characteristics and its own challenges. However, we also see that we also share common challenges. As I emphasize again, it's about climate change impact. It is about aging population. It's about NCD burden. It is about preparing for the next pandemic. And building on that, common ground, WHO will provide continued support to member states on these key, priorities. And I continue to ensure that we will support member states to transform the health system, especially primary health care, to achieve that we can access, people can access to the accessible, affordable, and quality health care. And I think this could be applicable to all countries and member states in the region, no matter the population size or the context. Of course, we also need to take into account the specific or the unique challenges of each country to provide the support. And WHO over the past year, we pay a lot of attention on policy development and system development. Instead of doing the pilot project, we have a long-term and system approach to support member states to build up their own healthcare system. I take an example. In Vietnam, we have been, when I work at the Ministry of Health, we have been supported by WHO on the three key areas on policy development. First one is about the strengthening human resource for health. Second one is about hospital autonomy. And the third one is strengthening primary healthcare. With that kind of support, the technical support and policy development support, we can help the country to develop their own health strategy on health system, which is resilient and which is also equitable for the people who need them. Thank you very much.
I shall now give the floor to Solomon Islands to ask their question.
Thank you, Honorable Chair. And let me thank Dr. Tran Huang for the excellent presentation. Now, my question is, if you become or became the regional director, how would you position the WHO regional office to strengthen human resources capacity in the Pacific Islands to help them address their capacity gaps in a progressive, sustainable manner? Thank you.
Thank you very much for the question. It's very important issue. And even the COVID-19 pandemic revealed that how much important the human resource for health. We see that in many settings, in many countries, now the health sector facing the shortage of healthcare workers. After the pandemic, many people left the health sector due to the burnout and also the difficulty situation that they face. And according to WHO estimates, by 2030, we are in the shortage of 10 million healthcare workers around the world. And it is the WHO's priority to support member states in this very important area. I believe you know that in the upcoming RCM Regional Committee meeting, there will be the new regional framework on human resource for health. And this framework will have member states to address the issues of human resource for health. And for the Pacific Island, the situation even getting worse. When I visited a Pacific Island country, I saw only one public health nurse who delivers all public health programs, NCD, CD, mental health, and even during COVID-19 pandemic. I also know that she is the one who take care of the COVID-19 vaccination in the community. So for Pacific Island countries, I believe we need to have a system approach and also taking into account the uniqueness of the region, of the sub-region. Because you have the limitation on the number and also the quality of the people. And I realize that, in the context of the upcoming term, once again, I would like to mention that primary healthcare is still critical. And we need to equip the healthcare workers at primary healthcare level to be, to be having the skill to provide the services, the mixed skill, the integrated, who can deliver the integrated services to the community. We cannot expect to have one healthcare worker in a small island country to just only deliver one technical program. So it's really, it's not possible. So when I work at the regional office, I work with my team on communicable diseases. They are responsible for vertical, disease program. I always remind them that when we work at the Pacific, do not expect to have enough people working on only one disease. You need to have a system, integrated system approach. And I believe that in Pacific, you should also apply the same model of, integrated system approach and train them and provide them improve their capacity so that they can address multiple health challenges. And at the same time, I think it's really important for Pacific to increase the number of healthcare workers because you are really in the shortage situation. WHO could be in the position to work with other partners and institutions to strengthen or increase the number of healthcare workers in the Pacific. It is what we can do to support you in terms of human resource for health. Thank you very much.
Thank you.
I shall now give the floor to United States of America to ask their question.
Thank you, Mr. Chair. And thank you, Dr. Tran, for your helpful presentation. It gave us a lot of useful insights. So Dr. Tran, if elected, how will you build trust with Wipro staff, promote ethical and equitable culture, and exercise sound management practices to ensure that there is enhanced accountability at Wipro? Thank you.
Thank you very much for the question. I would like to share with you my story. Since I joined WHO in 2019, I already, work with my team to ensure that we can, create the motivating and supporting environment. I open my door to all the staff who can share with me any concerns that they have. And I think open communication should be very important, the first step. And then what is the more important, the next step is that you address those issues they raise and you have a prompt response to them. So I just also want to share with you, my division consists of, colleagues coming from more than 20 countries and from different, cultural backgrounds. I try to always put the priorities on respecting workplace culture, especially respecting the culture diversity and making our division as working as one family, as one team. So I found that this approach of open communication and inclusive leadership, that I always take into account any voices or any opinion from the colleagues and to come up with the collective decision-making process, which makes our division is really become a very very, working as the one team. It is what I can share with you when I work as the director of one of the biggest division in the regional office. In addition, I also work with other colleagues at the global level, headquarters, and the country levels as one team. So we call it is a DDC extended family. I would say that because I connect with the country office and not only the regional office working only among ourselves, but we're really working as one team. And it is also my priority to enhance the coordination among the three levels of the organization. I also like to continue the effort made by our acting regional director on the simplification process to ensure the efficiency of the organization, especially reduce the unnecessary administrative burden and the bureaucratic in the organization. But most importantly, I think building the trust and respect and the psychological safety is the key to ensure that we have built up a strong team who can work closely together. Thank you very much.
Thank you.
I shall now give the floor to Japan to ask their question.
Thank you, Chair, and thank you, Dr. Hong, for your presentation. The Wipro region has a population of 1.9 billion people, some of whom are large countries and some of whom are small countries with population of only 1,000. The economic scale of the countries also varies country by country, and there are large differences in the healthcare system delivering system. In this regard, we would like to know what is your priority measure to take in order to achieve universal health coverage in our diverse region? I thank you.
Thank you very much for the question. I believe the transformation of the health sector would be very important, no matter how big or how small the country is. And the most important thing is to ensure that we can deliver the services to the people when they most need it. And the universal health coverage means that we can provide the high quality services when people need it without financial hardship. And in order to achieve that, we need to have an innovative approach, especially for low resource setting country. Primary healthcare is proved to be effective, approach to support member states to achieve their universal health coverage goal. In addition, I also advocate for promoting the healthier population, which means that we shift from the sick system to the health system. With health promotion and health prevention would be our emphasis. By doing that, you can keep our population in a healthier side, and you can, avoid excessive investment in the treatment part. By doing so, we can help the country with limited resources to achieve universal health coverage in the most efficient and effective way. So it is my key approach for supporting countries on transforming the healthcare system and promoting the healthier population. Thank you very much.
Thank you, Dr. Huang.
We have now exhausted one of the question to Dr. Chan, but this still the time remaining before the 60 minutes allotted for this interview have elapsed. In accordance with what has been previously agreed, I will now open the floor for any regional committee members which have not yet asked a question and wish to do so now. In this case, please raise your hand in Zoom. As I see no hands raised, the candidate is invited to make any additional statement you wish until the end of the 60 minutes. Dr. Chan, you have the floor.
Thank you so much, Mr. Chair, for your generosity. I have now 2 minutes and 30 seconds to have my last statement. How lucky am I? I would like to take this opportunity to thank you very much, Mr. Chair, for your able leadership. And it was really a great section, and it's a lifetime experience for me. I would like to also to thank Dr. Jacob Susanna for her leadership and also facilitation to make this happen. It's really truly the great move toward the transparency in the selecting the regional director. I'm sure many of my friends, my colleagues, is now are following me on social media and other media platform. And I would like to thank all the member states, distinguished member states, for your great support and your close collaboration over the past years, especially during the pandemic time. It's a testimony of our solidarity and our cooperation. I see the beauty of strength and the strength of the solidarity in our region. That makes me, very inspired and passionate to serve our region better. So if I'm elected as the new regional director, I'm committed to bring the new dynamic and the passion to serve the people in the region. And putting people at the center of our work is WHO noble mission. I believe with your continued support, we can build the region, our region, to be healthier for the future, for future generation, and you work really as one team. So thank you very much for the opportunity, and thank you so much for all the support you provided to me. Thank you so much.
The total time for this interview has been exhausted. Thank you very much, Dr. Tran, for being with us today. You may now have leave the conference hall. This concludes the live forum for candidates for the WHO Regional Director of the Western Pacific. I would like to thank all members of the Regional Committee and all candidates for having joined the forum today. We had a rich exchange which will be valuable to member states in their assessment. Before closing, let me remind you that the password-protected web forum for question and answer is open until Sunday, 17 September 2023 at 23:59 Philippine time. Candidates will have the opportunity to reply the question until Sunday, 1st October 2023 at 17 p.m. Philippine time. After its closure, the web forum will remain available to member states in read-only mode until the closure of the 154 session of the Executive Board. I wish you all a good evening and look forward to seeing you in Manila next month for the 74th session of the Regional Committee. Thank you very much.